Ne trebaš ti ništa govoriti. Ana, Banka Srbije, sport, Amil Štarci, Bosna, ovo će Mihajlović. Rekao sam sport. Mihajlović je poslije tebe prijavljeno, ja neće ja rekao. Vidiš, ako Srbija može nam tekati poslije. To Mihajlo govori. Tako smo se dogovorili, sam još jednom gledali sa njom. are here today with us in person and also online. Just a quick note that this conference is being recorded. And also on your badges, you have a QR code that you can scan and access the program. I am Amil Družić. I am the Vice Chair of the HPV and Hepatitis B Focus Network of the European Cancer Organization. And I'm also an oncology and radiotherapy specialist with a focus on the treatment of HPV-positive oropharyngeal cancers and other head and neck cancers. This event is organized by the European Cancer Organization together with the European Society for Gynaecological Oncology and Romanian Football Federation. We bring together key stakeholders to advance the discussion on HPV prevention. We are grateful to the Romanian Football Federation for kindly hosting this event and supporting us in the facilitation for this important conversation. Today's discussion builds up on the last year conference. The first Southeast Europe HPV conference was held in Bulgaria, and now we are here in Bucharest. The first conference marked the first focus of our organization on the Southeast Europe region. And I will now hand out to Mihaela the stage to introduce the scene of the day. So you can.
Thank you, Amil. So my name is Mihaela Grigore. I'm a professor of obstetrics and gynecology at Grigore Popa University, Iași, and I'm also a member of ESGO Prevention Committee. I would like to thank, first of all, ECHO to organize this meeting, but also to ESGO as a participant, to Romanian Federation of Football, and of course to all speakers and participants. And please let me inform you that we have participants from all countries from the Southeast Europe. So we are a big community here with the same mission, with the same goal, to eliminate the HPV-related cancers. And I ask you, do you think it's possible to eliminate it? Yeah, exactly. We can eliminate because we have the tools exist. So what we need that to bring these tools to all women in our region. So thank you once again to be here, and I pass the microphone to
Anil. I need now to introduce our program for today, but I cannot see the slides. If it's possible to get them. Yeah, next slide will be, I will try to. Yeah. So you see the program of the day will be compiled in a couple of sections between coffee breaks. We will focus on country spotlights, then we will transfer to tools, how to eliminate and make the prevention better, and then we will make a special policy-focused part of our conference. And I would like to introduce now Victor Negrescu, the Vice President of the European Parliament. He will be addressing us in a pre-recorded video format. Unfortunately, he cannot be today with us because he had other meetings to attend. And his talk and speech shows the political commitment of this event and our shared goal to strengthen the elimination of HPV-related cancer at the European Parliament level. So please welcome Victor Negrescu that he is talking now in a pre-recorded video format.
Dear organizers, dear participants, it is a real pleasure and an honor to join you, even from a distance, through this short video message for this important initiative. Let me start by congratulating the organizers for bringing together such a strong coalition of policymakers, clinicians, public health experts, and patient advocates. This type of partnership is exactly what we need more of in Europe, because eliminating HPV-related cancers is not just a health objective. It is a shared societal mission. We are here today around a very clear objective: eliminating HPV-related cancers in Southeast Europe. And this is not just an ambition. It is something we can actually achieve, because HPV-related cancers are among the clearest examples where science, public policy, and society already have the tools to succeed. We know what works: vaccination, screening, and awareness. And yet, progress across our region remains uneven. This is not a medical failure. It is a policy and delivery challenge. As Vice President of the European Parliament and as a member of the Public Health Committee, I have made public health a central priority of my work. I have consistently argued that our ambitions in health must be matched by real funding and real delivery. This is why I have pushed for stronger EU budgets for prevention and early detection, more investment in health system resilience, and targeted support for countries and regions where gaps remain. Because today, the reality is still unacceptable. A person has the chance to survive cancer in Europe depending on the place where he or she are living. And in the case of HPV-related cancers, the disparities between Western Europe and Southeast Europe are still too large. If we are serious about eliminating HPV cancers in our region, we need to act decisively on three key fronts. First, vaccination. We must move from limited coverage to universal access. Vaccination should be accessible, affordable, and integrated into schools and primary care systems. At the same time, we must address misinformation and mistrust and be as transparent as possible, because public health policies only work when people understand them and trust them. And this requires clear communication, community engagement, and stronger partnerships with healthcare professionals. At European level, I will continue to advocate for EU funding instruments to support these efforts. Secondly, screening and early detection. Vaccination protects the future. Screening saves lives today. We must ensure that every woman has access to quality cervical cancer screening regardless of where she lives. This means organized programs, proper follow-up systems, and outreach to rural and vulnerable populations. Actually, digital tools can help us do better, but only if they are implemented with a clear focus that no one is left behind. Thirdly is about awareness and partnerships. And here again, I want to underline the importance of what you are doing today. The involvement of the Romanian Football Federation shows how we can bring health messages into spaces that truly matter to people. Because sports has reach, sport has credibility, sports connects with families and young generation. We need more of this type of collaboration across Europe. Dear friends, eliminating HPV cancers in Southeast Europe is not just a distant goal. It is within reach if we treat it as a shared regional project. Because in this case, success is not abstract. Success means fewer diagnoses, fewer lives lost, and a generation that no longer fears preventable cancer, so it is important to act. From my position in the European Parliament, you can count on me to continue supporting this mission. Thank you, and I wish you a very successful and impactful conference.
Thank you, Victor Negrescu. And we just heard from the European Parliament a clear signal of political will. Now let us look at the reality on the ground across our region. We will have spotlight sessions, and each country that are going to represent what's the status now is going to be Romania, Bulgaria, Serbia, Bosnia and Herzegovina, and Greece. And I would like to call now Ratka Argirova from Bulgaria, Anna Banko from Serbia, and Menia Tijani from Greece to join us. To start, I will ask Mihaela to present Romanian status first.
Thank you again. So I already introduced myself. Can I have the slides, please? So as I told you, I am a member of ESGO Prevention Committee, and also I am a president of Romanian Society of Colposcopy. And I would like to start, before I discuss about the situation in Romania, I would like to say a few words about ESGO Prevention Committee. Well, this committee is part of the big family of ESGO, European Society of Gynaecological Oncology, and the main goal, the main vision of this society is to offer best treatment and prevention for gynecological cancer. It is an important society, and the mission is to improve health and to improve the well-being of the women with gynecological cancer through advocacy, prevention, research, excellence, and education. And also through advocacy, because ESGO is also do this type of action of advocacy. And here you have an example from this year in January. It's an action which took part in European Parliament, and you see ESGO is quite involved also in this type of action of advocacy. But let me tell you about situation in Romania, because this is my talk. And what I can say that things are improving in the last years. Regarding vaccination, what is the current situation now? We offer free vaccination for girls and boys between 11 and 26 years old, so it's a neutral gender vaccination. And moreover, we reimburse 50% vaccine for women aged 27 to 45 years old. So we have quite a good program, and what we can say that vaccination is available, but we also must admit that it is not truly accessible. And why is that? First, because of the infrastructure. Because vaccination is delivered mainly through family doctors, and we know that there is not uniform the promotion of the vaccine among family doctors, among GPs. And also, what we lack a school-based vaccination programs, and we think that if we will have this type of program, schools-based, we can arrive to a better coverage to the teens, because the ideal is to make the vaccination in teens. Another barrier is represented by awareness, and like in all other countries, we also have an anti-vax movement, and this movement can be sometimes quite powerful, and her voice is very loud. And also, maybe we have some limited national communication campaigns, and also a low awareness among parents and adolescents. And of course, we have some inequities between rural and urban populations. So now we can say that Romania is transitioning from hesitation to acceptance, but the progress remains fragile. So we need to take care of that. So what we can saw in the last year, we saw some policy improvements. For example, we saw the expansion of reimbursed HPV. You saw we offer free vaccination, neutral gender vaccination until 26 years old, which is very good. And also, we have increasing political recognition of HPV vaccination as a cancer prevention tool. You saw Radu Negrescu, the vice president of the parliament. So we have the politician on our side, and which is also very good. Then we have strong advocacy from gynecologists and public health professionals, and we also have engagement from important societies like Romanian Society of OBGYN or Romanian Society of Colposcopy. And last but not least, we see the progress. We see an intake, a gradual intake in vaccine uptake, and more visibility of this topic in media and medical education. But we can do more. So what we can do more, because we need to do more. We need to implement proven implementation models. So we don't need to invent the wheel. We need to apply models from the countries where the vaccination has very good figures. Also, we need to improve the communication strategies, and here these type of meetings are very important. And also we need to improve the training and advocacy. And again, this type of meeting, this type when we meet together, when we share experience, are very beneficial, not only for us, but also for all countries, in our case, for all countries from the Southeast Europe. So, to finalize, in order to accelerate HPV vaccination, Romania needs not only the vaccines, but also needs trust, needs systems, and needs regional solidarity. Thank you very much.
Thank you, Mihaela. We saw huge progress in Romania, but also the gaps that remain. But now let us transfer to Bulgaria, and Professor Radka will address us. We wish you very welcome. And
Okay, dear Chairperson, dear colleagues, dear delegates and guests and online listeners also. It's a great pleasure and a high honor to be here among you and with you. And I'm representing the Bulgarian HPV coalition. And I'm very proud to show you the progress and also the problems of the Bulgarian fight against the HPV cancers. Well, now I shall show you the progress and also some problems after the last conference in January last year. Yeah. You know, of course, that we have organized an HPV coalition. This was in 2023. And we had very strong and very clear goals with it, advocating, education, information, and so on, which were all the time performed by a good team of professionals. And we are now ready to share our experience, especially on the work with journalists, patients and parents' organizations, which is very important, of course. And now, the second thing we have organized during that time was this first conference last year in January in Sofia. A lot of you were presented at this conference, and this conference was under the patronage of the 51st National Assembly, which means that the National Assembly was committed, highly committed to the HPV issues. The first pillar in the prevention, the primary care, the primary vaccination, was very important for us to start with, and we started it in April 2025, it means last year. We adopted a national program for primary prophylaxis, and this national program was introduced into the country. And today I can say that starting from only 3% vaccinated persons, we are now at, let's say, at 6%. And this vaccination is neutral for boys and girls, of course. And each year we increase the age of people who should be vaccinated. Overall, the vaccination coverage slowly increases, very slowly. We are still much lower in this coverage, much lower than the other people in Europe. And here in this slide, I would like to show you, we have conducted a special study on the attitudes to vaccine in Bulgaria. And we have found 5 groups of persons with whom we work separately. First of them are anti-vaxxers, hardliners, anti-vaxxers, with whom it's not possible to work, but their percent is something 12–16%. So no normal scientific or whatever research or facts is not possible to be introduced into this society. The second group is about 25% the people who support the vaccine. The third group are people who are hesitating, who have some questions or who are unclear about it. And this group is the group where we can target our efforts and our efforts, yes. And then after that we have another 2 groups who are so positive adherents, so they do everything what the Ministry of Health says, and people who are absolutely uninformed and don't like to be informed. With them it's very difficult to work with. So having all these groups, we started to target our efforts to work with them on vaccination. And the second pillar, the secondary prevention, as you know, of course, is the screening programs. Here we started our work and now we are in a transitional period between smears, pap smears, and introducing of HPV DNA tests. And these efforts came to adoption, principal adoption of the second national program for screening, which was adopted only a week ago. And now there is a special task force who will decide on the details of implementing of this program. The secondary prevention, we have 3 preclinical phases which should be performed simultaneously, and this is very important for us. The samples taking. The second is to select the laboratories to work with, and the third is to make this algorithm of what to do after the results are coming. We shall have in our screening programs persons from 25 to 65. It's written 20 here, but because we hesitated, because our population has so low vaccination coverage, I thought about 20 years, but now it's 25 to 65. And about the tests, also we have some problems, and here is the slide which we are always showing to our managers, chiefs, and in the ministry, and also when we work with gynecologists and general practitioners, the 2 kinds of results coming from different sample taking. In the left side you see when it's self-sampling and it has a vaginal secret, which gives only the HPV type. And on the right side, you see when you have a cervical secret, and you can go further with this HPV DNA to cytological triage. Of course, we think and we are sure that the self-sampling will be something additional. The first should be a cervical sampling by gynecologist, and the self-sampling will be something additional with the progress of the program. And now I have summarized here the main tasks of Bulgaria regarding HPV screening. Gradual introduction of HPV DNA tests, of course, first as a pilot screening, with the first goal immediately sending individuals with the positive results for colposcopy. The second one is rapid implementation of algorithm to tracking individuals with this CIN1, CIN2+, CIN3+, and those with different findings from PCR. The third, rapid registration in the National Health Information System for the conducted research. And the fourth, in other things, which are, for example, organizing of laboratories, of external control, working with different technical availabilities and different human resources. So thank you, and I'm open for your questions. Thank you.
Thank you, Professor Radka. We saw the accelerated progress in Bulgaria after our first Southeast Europe conference regarding HPV, and this is the reason why we do these conferences, to accelerate the progress in this field. And also I would like to say that it's really good to see that Bulgaria is going towards HPV testing. Now we're going to switch to Serbia and to see how Serbia compares. Welcome, Professor Ana Banko.
Thank you, Amil. Good afternoon to all, and thank you for being here in person and online. It's my honor to represent Serbia here today and to show you problems that we are dealing with still, and also some new steps forward from our last meeting in Sofia. So Serbia Spotlight could be described as challenging, as we are believed to be on the crossroads. Numbers that I will show you briefly represents a high problem of the burden of cervical cancer, and probably it should be one of the highest positioned public health priority. So some of the data showed here demonstrate that Serbia is among the European countries with the highest incidence and mortality rates of cervical cancer. You can see the number here and our position that is not positive. But however, the major concern in Serbia is that in population between 15 and 44 years old, cervical carcinoma mortality is the second leading cause of cancer mortality in younger population. So that's something that's really concerning, and it's not only the problem about the primary prevention, but also about the secondary prevention, which will be also described by Vesna Bondžić, who is also today here, and she will present some data about the screening policies in Serbia. You can see this slide from our public institution site about the mortality rates. And as you can see here in the purple line, it's just straight. The last 30 years, even we have many new developments in screening and also introducing of the HPV vaccination. nothing is happening in a change of mortality rates as we are dealing now. So it is a fifth leading cause of death in females in Serbia. So as the primary prevention probably has the strongest impact as shown in countries that introduced this primary prevention 2 decades ago, I can show you that this is a very young national immunization program started from 2022, which is fully covered by our health insurance. It is gender neutral. We cover 10 cohorts, 9 to 19, with the target cohort 12 to 13 years old during the 7th grade regular checkups, and it is delivered through primary health centers. It is recommended vaccination with unique characteristics because in our immunization program, it is the only vaccine recommended but also fully covered. What is almost perfect on a paper, in reality, is not just with results we wanting to perform. In the first year, it was very positive, but after that, it shows that accessibility is not enough to reach the results. So one of the problems here that we can see, even we could vaccinate all 10 cohorts, fully covered, without any appointment, everything is open. We do not have the school-based program. And also something that you can see here, it's a recommendation, is something the big issue, because Serbia has the immunization program, which has mandatory vaccinations. And something that could be, I can say, problematic is this recommendation. So results from that 2022 is with VCR less than 10%, not too bad, but not good. And by March 21st this year, 151,000 doses were implemented. But you can see that we spread it, our implementation program in adult population. So we, by now, vaccinated 7,000 doses in adult population older than 19 years old. As I previously mentioned, the accessibility eventually is not the only thing that we need to perform results that we want. We provide some knowledge and evidence about the awareness in a population of parents of those children in 7th grade, the target population for vaccination, and this is some of the market research from 2024 and 2025. From the first question, have you ever heard about HPV, the results were very positive. But if you ask them how likely you have or had HPV, it's less than 12%. So when we are going through these questions, we see that they are aware, but not enough. And in the end, the most problematically, it's the only 15% will intend to vaccinate or is vaccinated their kids. And with 15% in 2024 and 70% in 2025 that are against vaccinations. What we can do, we made the HPV immunization initiative. That's the main result that I want to present here. Last month, Health and Family Committee of the National Assembly of the Republic of Serbia accepted and supported the initiative from NGO Progovori, and Selena will discuss it later, about the position of HPV immunization as mandatory. Voting was very positive with a strong consensus with high political alignment of HPV prevention. So key arguments presented was significant burden of HPV-related diseases, need to improve cervical cancer prevention with alignment with WHO preventive strategy, with examples from our neighbor countries like Croatia and Bulgaria with similar initiatives. So decision has been forwarded to the Ministry of Health. We're expecting their response, and then response should outline further implementation steps. So we are very positive. In the meantime, with strong evidence of immunization of adult population and many national immunization recommendations that you can see here in European countries, with the evidence that also it's the effectiveness in ill and women treated of HPV-associated disease, with strong evidence of scaling up HPV vaccination to eliminate cervical cancer, we implemented new guidelines for the professional and methodological instructions on immunization from this year, from January 2026. We vaccinate individuals free of charge aged 19 to 26 years old, and also individuals aged 27 to 45 years old based on a specialist recommendation. We believe that every step we do today, and we have major 2 steps from the last year and meeting from Sofia, we will design the future. So let's see if we are on a crossroads and if the Serbia can or cannot make some very impactful steps now for our future. Thank you so much.
Thank you, Anna. Huge progress in Serbia since last year. I would like to congratulate you for that. And I'm going to now present the spotlight from Bosnia and Herzegovina. Okay, it's here. So, my country came from no vaccination program in 2022 to gender-neutral vaccination in a couple of years. So, you can see here the timeline. I was talking about this in the last conference. We first started with a pilot project with the help of the United Nations Population Fund in Canton of Sarajevo. It was a success, and then expanded it to other cantons, because you know the complex structure of Bosnia is it makes us really hard to implement changes in the health system. We have two entities, and then the Federation of Bosnia has 10 cantons, and then we have Brčko districts. So it's really challenging to do that. But the pilot project showed us that we can do it on that model. In 2023, the first vaccination program started in the Republic of Srpska for boys and girls. In 2024, in the whole federation, so all cantons adopted it. And then after the conference last year, there was this huge will to bring gender-neutral vaccination in the whole country. And now we have gender-neutral vaccination in the whole country, which is a huge success. And again, we can see what can come up from a conference like this, because as you remember, last year we made the declaration, and from Bosnia and Herzegovina, the declaration was signed by the major health governmental systems like the Clinical Center of the University of Sarajevo, the medical faculty, and a lot of more, and other NGOs also signed the declaration and was committed to make change, and that was the results that happened. So the only thing we have now, like we have a gap in data. Data is not correct, because GloboCan estimates are for me, I think they're underestimating the real number of cervical cancer patients in our country, especially when we take in the data from my center, where we treated over 154 cancer patients, cervical cancer patients in 2022, and that is again a clear sign for a registry for cancer patients and also for vaccination. Also, I wanted to say that the screening in Bosnia and Herzegovina is still opportunistic, but we had also another pilot project in the canton of Sarajevo, where we started cervical cancer screening, and also some kind of implementation of HPV DNA testing. And I hope this is going to be the model for other cantons to follow, so we can, next year, we meet here and gather. I will have some, I hope, new data, and that show that we have better non-opportunistic cervical cancer screening. So these are one of our priorities in the coming year, and I just want to highlight that we are working hard on bringing the HPV vaccines to all the girls and boys, and also what is more important, now we have the recommendations, and all for boys and girls until 25 to 6 years they can get the vaccine also for free. So which is a huge progress from the last year. So I would like now to give the floor to Greece, to Menia Kogiani, and she will speak about the spotlight and what is the current state of Greece right now.
Thank you, and thank you for the invitation. Now I have 4 screens inside me. I will choose in which I will look because I have to change glasses. So I'm Menia Kogiani. I am the lead of the HPV task force of the Hellenic Cancer Federation, a LOC from Greece. So I'm going to present to you and discuss with you, because the most important of these meetings is the open discussion, the strategic roadmap for screening prevention, and the national drive toward an HPV-free future in Greece. So last year, the Hellenic Cancer Federation decided to have an HPV task force. The members of this working group is Maria Theodoridou from Crete, Andromachi Athinou from Thessaloniki, Maria Dzima from Ioannina, and Rodoula Kokinaki from Rhodope. And of course, we have the valuable support and help from Marina Ximeri. We decided to have this group because we need to work more close, and not only with our federation, but with the whole ecosystem in our country. So our framework is that we're having 4 meetings per year, online or in person. Our role is to advise a lot about the elimination of HPV-related cancer. We have subgroups for targeted initiatives and also a scientific advisory board. And of course, we have to report our progress. Our priorities from last year are the HPV awareness and education in Greece, the national and international collaborations, the transition from the translations of materials in Greek, because as you probably all know, and you will agree with me, the language barrier is a very important barrier we have to face, the policy advocacy and the stakeholder engagement, and of course to support any campaign and any vaccination initiative, not only from the members of the federation, but from anything that runs in our country and beyond. And we have also contributed to the publications such as the HPV vaccination guide of ESGO. So, how Greece is doing? The good news is that the last years, our country is showing very good results, and the state priority is the prevention and the primary public health. Of course, we still need some actions because we need to transition from opportunistic to organized national screening. We have to increase vaccination awareness. I have to share with you that the vaccine is fully reimbursed in Greece for boys and girls. The reimbursement for boys was included in the national vaccination program for children and adolescents before 3 years. 3 years, and we have to face approximately 700 new cervical cancer cases annually. So the current challenge for my country is, despite the available tools, despite all the things and all the actions that the country has taken, the screening uptake remains inconsistent across different socioeconomic groups and geographic regions. We have a national screening platform via the National Prevention Program, ProLamvano. It started in May 2024, where a cervical cancer screening program was launched, and the target of this program is to have tested 2.5 million women aged 21 to 65, offering them pap smears every 3 years from the ages to 21 to 29, HPV DNA test for the ages 30-35 with follow-up doctor visits if needed, and all the procedures the women have to follow if the tests are positive. We have also worked very hard the last 2 years in different scenarios. Some of them are ideal scenarios. All the girls and boys are vaccinated in Greece. We have cervical screening programs. All the women follow their exams. But even in these 2 scenarios that you can see the numbers, and of course we can share with you, Greece can accomplish the target of the World Health Organization in 2067. So we have a lot to do. Probably the time is not by our side, but that's why we're here today, and that's why we're supporting all the initiatives that are running European and globally, because we have to eliminate all the HPV-related cancers. We have some national efforts and also very good and very strong public policy actions. We have the Spiridon Doxiadis program. This is the landmark in our country for national prevention program that offers the free HPV DNA test to millions of women. We are working very hard as a country for the digital integration. For example, we are receiving SMS in our mobiles that remind us that we have to follow our exams, we have to go to our doctors. There is a free line for calls from all over the country if a woman wants to ask something or a relative. And we have a very strong involvement of the Ministry of Health in monitoring vaccination registries. We still have some gaps in vaccination registry, and this is very important for all of the actions taken. But we strongly believe that after this year, even this is going to be solved in our country. And of course, we have the regulatory progress, and this is why I say to you that there are some public policies that are taken, and they are supported from not only from the government but from the whole Hellenic Parliament. The screening and prevention strategy that the Hellenic Cancer Federation has launched from last year, ELOC has a memorandum of understanding as a local partner of the international IPVS campaign, One Worry Less campaign. We translated all the materials of campaigns, the video, the leaflets, the social media posts in our language, targeting, of course, raising awareness about the primary prevention, meaning that the HPV vaccination is a gender-neutral vaccination. This is our main messages to all the Greek families. About the secondary prevention, we're raising awareness about the HPV DNA testing as the primary screening tool for women aged 30 to 65, and of course the clinical follow-up. Our national prevention program reimburses the colposcopy when it's needed, and the treatment of precancerous lesions. So about our role and advocacy as a cancer federation in Greece. We also have started last year a training program. ELOC is training its 52 members across country about the HPV. Not only about what HPV is, but also about the vaccination program, the safety of vaccines. This is something that is something that worries the Greek families about the safety of the vaccination. And we also want to support our members and provide them all the tools to communicate and collaborate with their local communities about HPV. Of course, the collaboration and the participation of ELOC in every European action and the patient support. because as you know, the priority of every federation is, the first priority of every federation is their members, and we provide online 24-hour support in our members about everything they want to know or to discuss or to look for about this very serious issue. And today, we would like to present you a best case of one of our members. I also have to mention that the last 5 years, the majority of the members of the Hellenic Cancer Federation, we are running a lot of campaigns about HPV. Some of our members, we are running campaigns for vaccination. Some other members, they are running campaigns about cervical cancer. But we have this case in Thraci. Thraci is a region in Greece that it has to face some burdens because in Thraci it is I think it's the biggest Muslim community in Europe. So the barriers are very important because we have to have discussions about health equity in this population. We also have to educate them and raise awareness about their access to health services because they are Greek citizens. And also to educate a smaller community inside this big Muslim community about HPV. So the member of ELOG, Dynami Psychis, is the name in Greek, means the strength of the spirit, had and still runs a very brilliant idea. In this geographical area, they run some second-class schools. This means that women from this community, from 18 to 60 years old, they go to school. It's a Greek school. So Dynami Psychis visits the school and tries to communicate and raise awareness in the students that they are Muslim women about HPV. The first step is, of course, to have some discussions and some presentations about HPV and the prevention tools we have. The second step is that they deliver to them a questionnaire before they start the trainings and a questionnaire after the end of the trainings, because we want to see not only the level of the health literacy about the HPV, but also what are their problems and what do they think or what do they believe it should be done about this issue. We are having some good results from this action. The first barrier, of course, is the language. Although the school is in Greek and all the material should be in Greek, they need to have the questionnaire and the presentations in their own language. So Dynami Psychis, the organization, is using a doctor that she can communicate in their language. They have a lot of questions. The majority of them, they have never heard about HPV. They have never heard about the vaccine or over the screening tests. And something that really worries me, because I'm also a mother, is that from 200 approximately students that go to this school and they have all fill in the questionnaire before and after the trainings, there was only one mother that has vaccinated her girl. So for us, it's very important not only to be here with you today and continue the discussion and the actions about HPV, but also trying to reinforce and support our members as a Hellenic Cancer Federation back in Greece to raise awareness about HPV, to increase the rates of vaccines, because the vaccine is not only reimbursed, but it's available for everyone, and to try to spot all the barriers and the difficulties because of the difficult landscape of our country to have access to all these tools we have for eliminating the HPV-related cancers. Thank you very much, and I'm open to every discussion you may have.
Thank you, Romania, for showing us what has Greece accomplished since the last meeting. And looking now back to this spotlight session, we see how the goals of the declaration from last year slowly are being realized, from strengthening data and monitoring to a gender-neutral vaccination, and also to prioritizing HPV testing in screening. And also what is really important, to gather stakeholders and engage them to act together to even more enhance the HPV prevention in our countries. Now I would like to, since we have a little bit of time, I would like to call the audience for questions for the participants. We will have about time for 1 to 2 questions, so if somebody has a question to address to the speakers, feel free to do it now.
Thank you very much to all of the speakers. Fantastic to hear the progress in all the countries in just 1 year, although of course there's much more to do. I was very struck in your presentation, Mihaela, that in Romania, as you described it, HPV vaccination is available but not yet truly accessible, and you were describing some of the routes of delivery for that vaccination. In the HPV vaccination good practice guide, which we'll be discussing a bit in the next session, we described maybe some of the countries such as Portugal that have been making use of pharmacies as a route of administering vaccination. So I just wanted to know whether you felt that was something that was applicable in Romania, and I'd be very interested in other panelists' views about that potential route for delivering vaccination.
Yeah, so regarding access in pharmacy is not yet available. Another thing that we do in Romania is that we have in big cities some vaccination centers. I had no time to explain the whole system that we have because the presentation was scheduled for 7 minutes. So I take now the opportunity to say that. So in this vaccination center, every people which is eligible for vaccination can come and can receive the vaccine. So this is a good thing because they will not need to pass to the family doctor, the GP, as I said, because the GPs sometimes and in some cases can be barriers to the vaccination in Romania. So this is very good that we have this center, but of course this is a good idea. Why not to introduce, and we will discuss about that, to introduce on a larger scale the vaccination. Another question?
I will use yours because I like you a lot. So I wanted to share with you that before 4 years we ran a survey among parents in Greece about the vaccine. Okay, in Greece we do not visit GPs. All the Greek families have their own pediatricians for their kids, even if they can go to hospitals, to public hospitals. We prefer the private pediatricians. We questioned the parents. It was approximately 2,000 parents that participated in our survey, but why they don't vaccinate their kids. And the result is that they didn't get the advice from their pediatricians. So there is still, especially in Greece, I don't know if you have this data in other countries, that pediatricians, they didn't inform the parents about the vaccine. And maybe this is not only a matter of the safety of the vaccine, it's a more complicated issue that we have to start digging in. Because for me, as a mother of 2 kids, the main question is, why do not parents vaccinate their kids?
So the discussion is very long, and actually we discussed yesterday extensively on this subject. There are so many factors that are important in increasing the vaccination, but I think very important is the health professional. They need to trust the vaccine, and I can tell you something from my practice. When I'm asked about the vaccine, can I vaccinate my teens, my children, and I start to explain why is good the vaccine, the results, and so on and so on. And I can discuss 10 or 15 minutes, and maybe they are not quite convinced. But when I said, look, I have 2 children, I have a boy and I have a girl, and they are both vaccinated, and I no need to say anything else. The answer is, okay, I will vaccinate my children too. So personal example is very important, and I think that we as physicians, we need to give this signal, how important and how safe is vaccination.
Also, I would like to comment on that and give an example from Bosnia, especially the canton of Sarajevo, since you saw in my presentation that we like pilot projects, and it's a good model to start something and see how it's gonna go to other regions of our country. And now in the canton of Sarajevo, an epidemiologist, Dr. Asaf Salčinović, is doing an amazing job. He's working in the cantonal public health institution, and they are actually getting together all the patient organizations, all the activists, NGOs, to work together and to spread the message about the importance of HPV vaccination. And what they also do, they go to the elementary schools, talk with the girls and the boys, with the pupils, and also they go to the parents' meetings at the schools and to discuss about the importance of HPV vaccination. And I have now an unofficial data that now in Canton of Sarajevo we have an uptake of 40% in vaccination in boys and girls. It's not an official number, but it's pretty close to that. And this is an amazing success when you I realize it's only 1 year since the last meeting, but it's hard work. You know, you need to have a doctor, a team like that in every part of the country. You need to have motivated doctors, specialists, professionals that are willing to go to the outside, to the schools, to the universities, to visit in person and to spread the message and to give the people an opportunity to hear about the vaccine from really professionals and to give them the right information. So I think that is very important to do. We need to be more engaged. It's not only to talk here in this stage to you, and when we go back to our regular jobs, we need to be really engaged, and we need to be with the people to talk about this problem and to show them that this is really important. So that was my comment. If anybody has other questions or comments.
Why is it so difficult to have this vaccine mandatory? We see the best results in Australia, the next is Denmark. Why is it so difficult to have this mandatory?
Because it's forbidden by the law. I don't think that there's any vaccinations.
Can I just add something about this? Yes, because in Serbia we have some progress and we are expecting decisions, okay? It's a political will. You know, if you have the different messages in a public space, it's always the political will. However, as the Amil said, it's the very hard work, one by one. And in Serbia, pediatricians are in line, many scientists are in line. But we have
to deal and to educate all the doctors from all the specialties, all the pharmacists. We have to have one clear message. That message is, I vaccinated my kids or anything else. And by my experience, I will just add 2 sentences. One is hard work and very creative work with kids 15 to 19 in Serbia. We have many workshops, very creative, very within AI tools, etc. And the other thing is just do every day that work and answer when anybody asks you something about the vaccination. My answer is just ask me, what is one thing that is concerning you? In that way, you will get the right question and you could answer that. Not speaking half an hour about that. Just clear message.
So maybe in a few years it will be easier to have this vaccine mandatory after all this public.
No, I would like to say something, yeah. May I add something? All what they said is very clear and very important, and it is so, but I would also add something else. For example, in Bulgaria, we have to work also with minority groups, with different ethnos, and I could tell you that the work with the health mediators is very, very important. Not only the work with GPs and pediatricians and school doctors and so on, but also with these people who can help us do too much. So please have this in mind also. Thank you.
Thank you very much. And after this session, I think we all deserve a good coffee. But before that, we would like to join us to have a photo group, to come here in front.
Oh, yeah. That would be great. Test, test, test. It should be.
Is it too small?
No, I can read it because it's okay because also it doesn't really matter too much because
So after hearing the country's spotlights and national experiences, I have the pleasure now to introduce Richard Price, who is the Policy Director of the European Cancer Organization. And in the next session, we will focus on practical tools and resources developed to support countries in implementing effective HPV prevention policies. So let's together welcome Richard Price.
Thank you very much, Emil, and good afternoon, and thank you for joining us for the second session of today's HPV Cancer Elimination Conference for Southeast Europe. And the title of this session is very direct. It's about the tools to do the job. And there's no doubt about the on-paper political commitment of countries in Southeast Europe to achieving HPV cancer elimination. They are all member countries of the World Health Organization, and through resolutions and various strategies of that organization, they are, in theory, committed to all of that goal together. And all the countries in Southeast Europe who are members of the European Union are doubly committed through the HPV cancer elimination goal of Europe's Speeding Cancer Plan. So, why have we not achieved elimination already? Well, it's about the follow-through, isn't it? The goal is the intention, but we need the tools that are going to drive implementation. So I think the first session this morning we heard about the different and also similar challenges that countries are having across the region, and we think there are some universal solutions that can be offered through good guidance documents. So we're going to talk in particular about 3 tools that we think can help. The first is the HPV Prevention Policy Atlas. Where is your country on that map? Is it doing well? Could it be doing better? Or is it something else? Have a look at that index. You can find it out in the lobby. You can also find it online. But you can also see the scores. Where did that score come from? Which are the bits which need the most improvement? And in some countries, that might be related to vaccination. And in other countries, it may be related to screening performance. And in some countries, it may be both. So to help with that, ESGO has been delighted to work with our network and many partners to develop some helpful tools, good practices, and recommendations. The first that we published at the end of last year is called Closing the Gaps. And you can find a summary of that outside in the full report online, and we're going to have a presentation on its contents a bit later. And then hot off the press, because we've just published this in the last month, the ESGO Good Practice Guide on HPV vaccination. Again, a summary on that here today, full version online and a presentation to follow, but it can be summed up in 3 sentences. Make it policy, make it happen, and make it last. So more on that to come. So I'm delighted to have a range of expert presenters today to talk through those guides, but then we're going to be talking a bit more about some of the recent developments in practice and other highlights and examples for us all to perhaps take inspiration back to our home countries after the event. So first up we have the HPV Prevention Policy Atlas, and I'm delighted to have as joining us online to help with the presentation of this Murat Gültekin from the ESGO Council. And it's been a great pleasure to work with Murat for a number of years. And with this event, we want to achieve a number of things. We want to share good practices. We want to help forge connections across countries. But also it's about kind of energizing ourselves with the enthusiasm that we find from others. And there's never a meeting that I have with Murat where I don't come away with a little bit extra spring in my step to do work in this field. And I hope you'll feel the same way too. And with that introduction, I hope Murat is safely online. I know he's often double tasking, but there he is. Thank you, Murat.
Thank you so much, my dear Richard. It's always a great pleasure and a great honor to collaborate with European Cancer Organization, European Society of Gynaecology, and many of our different stakeholders in different countries. The goal, the target is the same, how we can eliminate the cervical cancer in the whole Europe, particularly in East Europe. And as you already stated, Richard, we really needed some sorts of map so that we can define where are we now and where we should move in the next step. And thanks to European Parliamentary Forum on Sexual and Reproductive Rights, It's one of our stakeholders in the state. And we usually make this atlas every 2 years with ECHO, ESGO, and many European experts. The aim is to show how we make a progress and what is the next step for different countries. So let's see how this atlas works. Next slide, please. So this is the policy atlas, and actually we are evaluating not only the official European Union members, but in a total 48 countries up to Azerbaijan, as you will see. Especially we are focusing on East Europe and Southeast Europe. And of course, the atlas focuses on primary, secondary prevention, and online information that's available for HPV and cervical cancer. So 3 main topics the countries get their scores. Next slide, please. So actually, we don't compete with the cervical cancer incidence, who is the champion, who is the last. Our aim is to compare the countries about, as Richard underlined, the policy, the funding of the policy, and the long-term existence of these policies. We first published the first atlas in 2021, the second atlas came up in 2023, and a recent one came up by this year, 2025. It's a very living document so that we can update every time with the new data, and please do never hesitate to approach ECHO or ESGO or me if you have some other new improvements in your countries. By this year, we have added 2 new criteria, which means that you cannot compare this year with the 2023. Next slide, please. So these are how we give scores to different countries. And this is the primary prevention scores. As you can see, an excellent country has national policies on HPV vaccination and primary prevention, some sorts of a national program on vaccination. There is gender-neutral vaccination, and of course, vaccination coverage rate is high for both girls and boys. And then, depending on what we have in different countries, the score can be excellent with 95% more, very good, medium, satisfactory, needs some improvement, or needs significant improvement. But these are the criteria for primary prevention. Next slide, please. The second topic was the secondary prevention, which is screening. An excellent country needs a mature organized screening program. It should be totally free. And we should have an availability and opportunity for self-testing too. And as I told you, both pap smear and HPV tests should be available. Depending on the different situations in different countries, your country may be excellent, very good, medium, satisfactory, or needs some sorts of improvement. Next slide, please. This is the final pillar, which is the online information, the latest scores of the countries. And as you can see, an excellent country needs an excellent information on HPV, vaccine, and screening, not only on different social media, but especially on the website provided by the governments. So, let's see what we have this year. Next slide, please. Well, based on these 3 pillars, we have, of course, counted the countries, but don't forget, we should never compare these figures with the 2023 atlas. Here we have 2 new criteria. One is the screening rates, and the second is the catch-up cohorts, adult vaccination and gender-neutral vaccination, especially in the primary prevention. So, next slide, please. These are our experts, and as you can see from many different European countries, many different European societies, ECHO, ESGO, and many others, IPVS, we have a lot of experts. Thanks to them for the whole efforts who have made this atlas happen and now in our hands. Next slide, please. Yes, and this is the situation. It's very clear. Half of Europe is green, half of Europe is red. And you can find the atlas during the coffee break and see individual scores of your country. But it's very clear, based on this 2025 atlas, we have a very clear band between the East and West Europe with respect to HPV prevention policies, and the great majority of the East Europe, unfortunately, is red. Next slide, please. Well, But actually, I will say that despite this redness, we still have a lot of progress actually when we compare with the old process. You will see now that in both vaccination, screening, and information, actually many of the Southeast European countries did a lot of good policies, but still, as I told you, West and East, there is a division and it's still very clear. So, next slide, please. As you can see, these are the three champion countries, which are Sweden, Portugal, and Denmark. Big congratulations to them. A lot of 13 countries are in very good position. 6 countries is in the medium, 17 countries in satisfactory, and 7 countries really needs improvement. And these are usually, as you can see, in the Southeast Europe. Next slide, please. So these are the 3 champion countries, the Portugal, Sweden, and Denmark. They are really excellent in the primary, secondary prevention, and also online information availability, gender-neutral vaccination with high vaccination coverage and catch-up cohorts is available, and in screening, free population-based screening with PAP and HPV and with high screening rates, and of course, all types of online information is available in the governmental websites. These are the champions. Next slide, please. And this is the country which needs the really significant, most significant improvement, which is Azerbaijan. We still need, because there is no any recommendation, no funding for vaccination, nothing for screening yet, and there is no any information. So we should probably focus on Azerbaijan on the next years, and also Southeast Europe for sure. Next slide, please. And my dears, this is our good and beautiful country, Romania. And meanwhile, I want to say my best wishes to Hagi, who is a legend in Turkey. We are in the football association, and Hagi is always in our childhood, the legend football player. So this is our Romania. It's not very bad. It's not very good. It's in the red position, but the score is 61%. We have good things like we have recommendations, some funding for vaccination. It's in the national routine program, and it's boys and girls are eligible, but the very low vaccination rates we have. In the secondary prevention, we should focus for Romania because only PAP test is now used. There is no self-testing and a nascent population-based screening, and we should improve some scores on the online information. But I am sure 2027 at last, Romania will be among the champions. Next slide, please. And we already listened many of our colleagues, but this is the situation in Southeastern Europe. Actually, you see a lot of green things which we are proved. Since 2023, in the last 2 years, we had a lot of improvements. Yes, they are still in the red zone, but there are a lot of, for example, in Albania, we see that the score is increasing to 54%, Bosnia increasing because of the gender-neutral vaccination. In Bulgaria, similarly. Again, in Kosovo, we see the introduction of the vaccination for the girls. Montenegro improved scores for good governmental websites. And similarly in North America, Macedonia, Romania, Serbia, and even in my country, Turkey. So, next slide, please. So, very shortly, this is our progress in the last 3 years. 4 new countries offered national routine program on vaccination. 12 countries now is gender neutral. And 4 more countries offer mature population-based screening. 11 more countries offer both Pap smear and HPV. And then we have a very nice registry, especially vaccine in 7 countries, and excellent governmental websites in additional 3 countries. Very good progress. Let's do more. Next slide, please. These are our key conclusions. Yes, there is a West-East, still red and green part, but we have significant policy improvements in the last 3 years, and overwhelming majority of the countries need to more to implement these policies. ESGO, we are all the scientists are here to support you, my dear friends. Just let us know how we can help you. Next slide, please. For us, for all countries, east to west, west to east, north to south, everywhere, please don't forget these key recommendations of ESGO ECHO. include vaccination in routine state vaccination schedules, establish a gender-neutral vaccination and offer it free of charge, please with an extended age catch-up groups, especially in elderly. For screening, we offer a free of charge population-based screening, including both HPV and pap smear with a self-sampling issue. And of course, for the information, please reliable evidence-based information, make them visible with better data collection on the governmental websites. Next slide, please. We just finished. I want to give my best wishes from Turkey to all of our Romania and Southeast colleagues, and also Richard Echo, and to the all experts working on these SATAs. 2027, all Europe will be green, I hope.
Thank you so much, Murat, and we'll pass your message on to Georgi Hadji if we see him. I'm sure we will. Really great slides, and I know that we're sort of encouraging speakers to use their time well, but those slides will be available for all our participants who are here today, and also those who are viewing online on YouTube. And I think one thing maybe I just really wanted to pull out from his presentation is this is not designed to be a tool to embarrass or depress, because actually there's a story behind there, and that is that each of those countries that may be marked red or orange are on a trajectory. There has been improvement in just about every country. So I think there is hope that maybe that map will become, if not entirely green soon, at least a lot less red. And that's what this conference is very much designed to help with. So it's been a great pleasure to work alongside...
Anchored, because experience shows that positioning HPV vaccination as a national cancer prevention policy rather than a standalone immunisation policy is associated with more consistent implementation over time. Is HPV vaccination governed through clear leadership and decision-making processes? Because these strengthen the translation of scientific evidence into national vaccination policy. And who is responsible for sustained performance and correction of HPV vaccination programs over time? Because political commitment and policy adoption alone are not enough. What is needed is a regular review of progress and timely corrective action. Vaccination delivery. Are vaccines delivered through platforms that easily and reliably reach the target population? Regardless of the setting used, organised delivery platforms that reliably reach adolescents, that is the key determinant of high vaccination coverage, regardless of the setting. And there is additional coordination required for HPV vaccination compared with routine infant immunisation, as many of us know in this room. And programmes that achieve sustained coverage are characterised by planned and recurrent delivery settings and arrangements for adolescents with clearly designated vaccinators who are trained and authorised to deliver HPV vaccination. And finally, are vaccination policies easy to implement in routine practice? Age, dosing schedule, administration, plus consent and authorization requirements, they should be straightforward to implement, aligned with routine delivery options and opportunities, and minimize the risk of missed or delayed vaccination. Data. Do countries have systems that can accurately track HPV vaccination uptake over time? Going back to that infant immunization example which I shared, we're targeting a different age group here, so there are different requirements compared to what we might have previously established. Additionally, a reduction in HPV cancer incidence, well, it won't be detected for some time after a vaccine has been introduced. Secondly, once that data has been captured, its value depends on whether it can be linked and used across systems in delivery, follow-up, and planning. It's interoperability, the term that you might hear thrown around. And finally, is that vaccination coverage data routinely and transparently used to review data? Because vaccine targets, ladies and gentlemen, help provide a concrete basis for accountability and program inclusions that it should be used for periodic monitoring. And also for its conversations that we've had in this room is actually being able to demonstrate to the general public the effectiveness of this intervention is a way to communicate the value of vaccines and the part that they can play in generating confidence in immunization programs. If we move into the communication more broadly, do countries have public health communication approaches that support HPV vaccination confidence over time rather than relying on a one-off intervention? Are those messages delivered through trusted messengers and designed to address the needs and concerns of different audiences? That includes adolescents, it includes parents and caregivers, it includes healthcare workers, as we heard in the previous panel, because the understanding and engagement of those stakeholders and the support of those messengers, it can make the difference between the success and failure of a HPV vaccination ultimately. And finally, are communication strategies informed by the data and insights such as coverage trends, behavioral and social insights, and adjusted over time in order to respond to concerns that we might hear from the general public? In terms of access and equity, is explicit emphasis given to defining eligible age cohorts and aligning eligibility criteria with delivery strategies in order to reach the intended population? Are cost and reimbursement arrangements a barrier to vaccination? We know that the European Council recommendation on vaccine-preventable cancers explicitly calls on member states to make HPV vaccination free of charge or fully reimbursed. And finally, do vaccination policies and access arrangements avoid the systematic exclusion of specific population groups? Because routine HPV vaccination programs, as we know, they can exclude specific populations and minority groups, and we need to make sure access arrangements are deliberately designed to prevent this. And finally, catch-up and extended programs. Do countries have strategies to vaccinate cohorts who missed earlier routine HPV vaccination? Are formal processes in place to decide, review, and adapt whether HPV vaccination extends beyond routine age cohorts? And are there dedicated delivery pathways for populations who are not reached through routine HPV vaccination delivery models, touching on that point I made previously? In essence, what good practice in HPV vaccination boils down to is, to repeat what Richard said, it is making HPV vaccination policy formalized in law, in budgets and schedules. It is making it happen through recognized settings with trained staff and simple pathways. And it is making it last through sustained budget allocation and the use of data-informed communication to sustain coverage. That's vaccination. Moving on to the second half, which is the second paper which Richard touched upon, which is the Closing the Gaps, the status of cervical cancer screening programs in Europe. It bears repeating the facts. More than 54,000 women are diagnosed each year in the region with cervical cancer, and over 27,000 of those pass away. And those cases are not evenly distributed, highlighted by the atlas from Murat. That incidence ranges from under 5 to over 22 cases per 100,000 in some countries. So Europe's Keep Beating Cancer Plan sets a target of offering cervical cancer screening to 90% of eligible women, supported by later council recommendations. And the major problem now is implementation. Commitments have to become functioning systems with organized interventions, invitations, quality assurance, and equal access across and within countries, touching on the wonderful Greece example from earlier. And the technical recommendation is straightforward. We've heard it from our previous speakers. HPV DNA testing should become the standard primary screening method because it detects the causal agent of cervical cancer directly rather than waiting for cellular change. And cytology should no longer be the primary test, but it should be retained as a triage tool. The paper that we've put together puts a strong emphasis on HPV self-collection, especially for women who are underscreened or harder to reach. And alongside that, countries should move away from opportunistic screening and towards organized systems with opt-out invitations, pre-booked appointments, SMS reminders, and evidence-based screening intervals. And finally, screening quality cannot be separated from quality, and you can see the recommendations that have been outlined there in terms of targeted outreach, community engagement, provider training is key, and ultimately those data points that I touched upon in terms of those public quality indicators. So thank you very much for your time and attention, and if you have any questions around those papers, please do ask.
Thank you so much, David. And really what was motivating us with those new tools is through events like this, through the discussions that we have with partners across Europe, we hear so often the same challenges, and we often hear actually some of the same solutions being offered as well. So we wanted to get that on paper as 2 key new reference points for where you can get help with any challenges that you may be experiencing in your country. I just also wanted to reassure our viewers on YouTube, we are monitoring your questions, so we hope if we can get to those, if we're all able to keep to time here, we'll do our very, very best. And commending again those documents to you, and I think one of the things I love about the vaccination guide is we've gone beyond Europe as well. We're looking at countries in Australia, but also sub-Saharan Africa, where some of the resource challenges are even more immense than in Europe, but they're showing us examples of how to overcome that. Great. Well, we were now keen to introduce the Voice of the Patient organization in the landscape of HPV cancer elimination, and we're aware of some fantastic work in Serbia, and I'd like to invite Vesna to come and talk to us a little bit about that role that you're playing, and maybe to inspire thoughts for other patient organizations in Southeast Europe.
Thank you. Just a moment. I'm grateful for the opportunity to present Bridging the Gap Between Policy and Reality in HPV Prevention, Screening and Treatment from the perspective of Women's Center Milica in Serbia. My name is Vesna Božić. I'm cancer survivor, and I am president of Women's Center Milica Association, National Association in Serbia. My association was formed 16 years ago, like a local association, but now we are a leading patient advocacy network for women with breast and gynecological cancer in Serbia. Women's Center Milica has a network with 6 associations for support patients and expert council. Expert council is a multidisciplinary expert council of leading oncology specialists. Role this council is support our initiatives and educating our members. We created the Oncology Social Navigation Program to educated patients navigator and certified patients navigator supporting women in Serbia. About Women's Center Milica is short, but what is disease? I'm sorry. I talk, but no. Okay. What is disease burden of cervical cancer in Serbia? Around 1,048 women are diagnosed annually. Around 410 women die each year. Cervical cancer incidence in Serbia is still about 5 times higher than the World Health Organization elimination target of 4 new cases per 100,000. Cervical cancer is the second leading cause of cancer death among women aged 15 to 44 in Serbia. What about HPV vaccination? Since 2023, HPV vaccination in Serbia has been available free of charge for all boys and girls aged 9 to 19 years. As of this year, a special program allows HPV vaccination up to age 45 based on a physician's recommendation. On paper, the national HPV vaccination framework is comprehensive and aligned with international prevention goals. In practice, vaccination coverage remains suboptimal due to gaps in awareness, physician recommendation, and public confidence. Only 4% program coverage. Bridging the gap between policy and real-world implementation remains a key challenge for effective cervical cancer prevention. Vaccination is for the future, but screening saves life of our women today. Screening in Serbia is not failing because it doesn't exist, but because it doesn't reach women. In Serbia, approximately 1.8 million women are eligible for screening. Result organized cervical cancer screening for 2025 is devastating. 100,934 women received an invitation for screening. According to the most recent data, only about 6% of women are invited through the organized program, and only about half of them go to the examination. What is with treatment? Access to essential and novel medicine for cervical cancer is limited in Serbia. Serbia remains among the European countries with the lowest availability of novel cancer medicines. Only 8, it is 14%, of 56 cancer medicine were available through the National Health Insurance Fund. For women facing advanced cervical cancer in Serbia, innovation remains out of reach. No immunotherapy and no biologic therapy. Women's Center Milica has formally submitted an initiative advocating for access to this therapy for all patients in need. I'm sorry, screening, and it is okay. Here you can see a key finding from the Swedish Institute for Health Economics, and as you can see, Serbia is far from the goals set by the World Health Organization UNIFIL 2030. And what about conclusion from the perspective of Women's Center Milica? Serbia has a recommendation for cervical cancer prevention and care. However, multiple barriers exist at every step of the care, but a way limiting real-world impact. What needs to change? Effective implementation on HPV vaccination program, obligatory vaccination, a functional organized screening system, equitable access to evidence-based and innovative therapies across all stages of disease. Very important, include patient organization representative in formal health policy decision-making process. What we have launched. We launched the initiative submitted to the National Assembly of the Republic of Serbia. Focus on introduction of dedicated budget line for the treatment of oncology patients and urgent availability of immunotherapy and biological therapy treatment. At the same time, we continue to work on awareness, prevention, and patient support, because change must happen both within the system and in society. This is our awareness campaign. And we are very proud because to be part of the biggest global awareness campaign to gynecologic cancer. It is World Go Day, and this is results global campaign last year's in about I don't see very well. We are proud part of this campaign. In the end, this is organizing board. And in the end, I would like to finish my presentation with the message. Together, no without her is mission that we do not accept a world in which women are lost due to stigma, taboo, and lack of support. Thank you for your attention.
Thank you so much, Vesna. And I thought that slide with the statistics was so strong. They were really sobering numbers that you were showing about the disease burden in Serbia, and it reminds us the urgency of action. Too many lives are being lost and impacted from lack of political action. And do mark your calendars. 20th of September is the next World Go Day, Global Gynaecological Oncology Day. So we should all join together in supporting that and other awareness days through the year. So part of what we're trying to do with the Southeast Europe HPV cancer elimination collaboration is to help connect the worlds of science, the worlds of patient organizations, the world of communications, the world of football, but also the world of science, of course, and that's where we want to maybe focus a little bit in our next presentation. I'm delighted to have online Elmar Jura, who is the head of colposcopy at the Medical University of Vienna and also chair of the ESGO Prevention Committee. So, Elmar, could you take us through some of the key scientific developments in the field of gender-neutral HPV vaccination to give us all a fresh update? Do we have you online, Elmar? I think we're just getting a signal from the tech team. It's on its way.
So, sorry, I had a problem with the internet connection. Now it seems to be restored. It's a pleasure to have the opportunity to talk to you today, and I will give you a brief overview why it's so important to do gender-neutral. Please. So next slide. This is my disclosure. Next slide. HPV causes 5% of all cancers worldwide, and as you can see on this map, especially in Eastern Europe, we still have a very high incidence, which is almost comparable to sub-Saharan Africa. So there's a lot of clinical need, and we have heard in the last presentation that in Serbia the country is 5 times above the WHO target. Next slide, please. So we all are surrounded by HPV. Almost everyone gets an infection, and the first proof, please go ahead, that the vaccine prevents disease and leads to elimination. Please move forward with the slide. Where genital warts, go on please. Genital warts, we have a lifetime risk of about 10% to contract this disease, and it affects both men and women. Next slide, please. And Australia was the first country to prove how effective this can be prevented, close to elimination. Next slide. We had, of course, to wait longer to see the same with cancer, and moving to the gender-neutral approach. We have a great example, rubella. When they started to vaccinate girls only, there were still a lot of cases of disease caused by congenital rubella, and only since public health moved to a gender-neutral vaccination, congenital rubella is almost eliminated. Next slide, please. We know that gender-neutral programs have a higher resilience, and in this model you can also see vaccinating girls and boys with a coverage of 60% has the same effect as vaccinating girls only with 90%, and only a few countries achieve 90% in girls, so only in the UK and in the Nordic country, but 60% for both girls and boys is achievable. And also when we have a breakdown of a program like we've seen during the COVID pandemic, gender-neutral programs are much more resilient. Next slide, please. Austria was the champion of gender-neutral vaccination. We did the very first European HPV vaccination in a gender-neutral fashion, and Austria was also the first country worldwide to give a gender-neutral recommendation as early as 2007. Next slide, please. In total, 6 cancers and the precursors plus genital warts affecting both sexes are caused by HPV. Cervical cancer remains the most important one, but what we see, next slide please, is an increasing incidence in the incidence of oropharyngeal cancer in men, which is exclusively related to HPV-16, and in many countries the incidence has already exceeded the incidence of invasive cervical cancer, which is on the decline thanks to screening. Next slide, please. Another cancer affecting both men and women is anal cancer. It's also on the rise worldwide, affecting more women than men, and we also have nice data, next slide please, from Denmark, that early vaccination reduces the precursors of anal cancer. The landmark paper about the elimination of cervical cancer comes from Sweden in 2020. Next slide, please. These Swedish epidemiologists have demonstrated that we have a 90% efficacy when we vaccinated at a young age. It still pays off when we vaccinate later, but the maximum effect we really get when we vaccinate early. Next slide, please. But we also have now data that the vaccine is effective in preventing male cancer. This paper was presented at ESGO in 2024. There was a 56% reduction in head and neck cancers in males presented, a huge database, more than 700,000 men. in the comparison of vaccinated and unvaccinated men. Next slide, please. And just recently, another paper has demonstrated that the cancer rate among males is lower in those being vaccinated compared to those not being vaccinated. Next slide, please. What is the global situation of vaccine coverage rate for girls? It's around 30%, and for boys it's 8%. So there's much room for improvement. However, especially the single dose policy of WHO seems to pay off and has increased the coverage rates, especially in girls. Next slide, please. Europe, in contrast to WHO, focuses on gender-neutral vaccination. So our target is not only to vaccinate 90% of the girls in 2030, also to substantially increase the coverage rate in boys. Next slide, please. When we look at the map, we see those countries which are dark blue, they have moved to a gender-neutral vaccination. So almost all the countries who can afford it have moved to those programs for the reasons I've highlighted. And especially with the new vaccines coming from China, which are pretty cheap, we might achieve a global coverage which is decent for both sexes. Next slide, please. So summarizing, what we know is that HPV vaccination is very effective in both females and males. The earlier the better. We can finally prevent 6 different cancers through early vaccination. And if we design a program, in Europe we have no upper age limit, so in the license, and to achieve a good coverage, it's good to vaccinate multiple cohorts, and gender-neutral vaccination is certainly the most important step to potentially double the vaccine coverage rate. And we've seen in many countries now that these programs are working, and we certainly have to work that this will also work in Eastern Europe. Thank you very much for your attention.
Thank you so much, Elmar. And I think a really welcome reminder as well that the power of this vaccination, it's not just cervical cancer, it's many other cancers as well that are on the rise, and also extremely difficult conditions that are so life-impacting, like genital warts, affecting literally millions of people across the world, all when we have the tools to prevent that. Another theme in your presentation was the power of data, and in our next presentation we're delighted to have Simona from the Director General of the Romanian National Institute of Public Health, and one of the themes that she'll be also picking up on is how data can help lead in policy implementation. That is also something you'll see in our vaccination guide and in our screening recommendations. So thank you very much, Simona, for being with us.
Thank you. First of all, I want to wish you welcome in Romania and to thank you for organizing this event, this important event here. Distinguished guests, I want to thank also for the opportunity to present on behalf of the National Institute of Public Health our role in HPV cancer elimination. So I will briefly present you the role of our institute in HPV cancer elimination, Romania's progress in vaccination, screening and cancer policy, the current gaps we still face, and our priorities for next years within regional cooperation. The National Institute of Public Health is the central institution for public health coordination. Our role in HPV cancer elimination includes 5 major areas. First, surveillance and epidemiological monitoring. We coordinate cancer surveillance activities, vaccination registry monitoring, and data analyzing aligned with the European indicators. Second, data collection and quality assurance. Third, we coordinate 6 of the national public health programs and also are involved with other ministries and regional health authorities and the World Health Organization in different types of projects. Fourth, the policy development and implementation. We contribute to the national cancer strategy and the implementation of the EU recommendation. And finally, but not the least, health promotion and communication. Romania's actions are strongly connected to the European and international frameworks. We align our work with the WHO targets, 90-70-90, Europe's Beating Cancer Plan, and the EU Council recommendation on cancer screening from 2022. We also are involved in several European projects as EU Can Screen, Clara, and SHIELD. These collaborations help us to improve screening quality, vaccination strategies, data system, and regional coordination. Romania's HPV elimination efforts have evolved for almost 2 decades. The first HPV vaccination program started in 2008. And of course, it didn't have the success that we wanted. Thinking now back, we think that the GAP was not a very good campaign, information campaign. After that, the first HPV vaccination programs, after that in 2012, Romania launched its first population-based cervical cancer screening program. And since then, several important milestones followed, as expansion of HPV vaccination eligibility, introduction of HPV primary testing, adoption of the National Cancer Control Plan 2023-2030, reimbursement of HPV vaccination for broader age groups, and development of national cancer registries. Looking ahead, 2025 and 2026 are focused on implementation of integrated cancer and screening registry. Through our projects, Clara is the most important, and also through the Resilience National Program under the national coordination of our institute. Despite some progress, Romania still faces major challenges. The first challenge is HPV vaccination coverage. The target is 90%. But Romania is currently around 23%. This gap is influenced how the other speaker told before, is influenced by vaccine hesitancy, misinformation, and unequal access. For our institute, the priority actions include evidence-based communication, intersectoral collaboration, improvement health literacy, and strengthening public trust in vaccination. The second challenge is screening coverage. WHO recommends 70%, while Romania remains below 30%, which, with much of the testing still opportunistic rather than organized. This creates inequalities in access and delays in diagnostics. To address this, Romania is transitioning toward organized HPV primary screening with call and recall systems and population-based registries. You also have the results of two of the most important projects, which I mentioned before. 2012-2017 was a population-based, the first population-based cervical cancer screening program for women aged 25-64, and the second one, 2018-2023, was a primary HPV testing piloted in 4 regions for cervical cancer screening. The result of the second pilot, of course, are better, but we have to mention that in the first one we didn't had the HPV testing. Further. An important initiative that I mentioned before is the CLARA project. CLARA is led by the University of Medicine and Pharmacy in Bucharest. Within this project, the National Institute of Public Health is a main partner. There are also involved 8 university centers, 2 NGOs, and the Romanian Society of Obstetrics and Gynaecology. Its objectives include improving access for vulnerable populations, strengthening quality assurance, training healthcare professionals, and developing culturally adept education materials. The project is especially important for reaching underserved women in rural and vulnerable communities. The third target focused on treatment access. Romania still faces fragmented referral pathways and delays between diagnosis and treatment. To improve this area, our institute is implementing the National Cancer Registry, the Cervical Cancer Registry, and the integrated monitoring system linking screening and treatment data through the 2 projects in which we are involved and I mentioned before. Reliable data systems are critical for evolving outcomes and ensuring continuity of care. At the same time, we continue advocating for sustainable and predictable cancer control policies. For the next 2 years, we have 6 strategic priorities. First of all, scaling organized screening. The second one, increasing HPV vaccination coverage toward at least 50% until 2030. Third, building integrated surveillance system. Fourth, reducing inequalities in access, especially for Roma communities, rural population, and low-income groups. Fifth, developing communication and health literacy tool for both citizens and healthcare providers. And sixth, strengthening the regional and European collaboration through projects, shared methodologies, and data exchange. Romania recognized that it has one of the highest cervical cancer burden in the European Union. But this challenge should unite us, not isolate us. We believe Southeast Europe can move faster through collaboration, by sharing knowledge, by building joint capacity, and speaking with one regional voice at European and international level. HPV cancer elimination is achievable, but only through coordinated and sustained action. Thank you very much for your attention.
Thank you so much, Simona, and you really demonstrated the critical role of national agencies in really both collecting, publishing, analysing the data, and then making sure that policy responds to it. And I think what also came across so strongly there was, yes, Romania is not at the WHO level targets yet, but you're responding to that, and there's a clear trajectory. And I think all countries in Southeast Europe can take some inspiration from that. So now, of course, the name of our session, the tools to do the job, we're going to hear about some developments in screening, and in particular HPV DNA screening. So we're going to go back to Ankara and hear from our colleague Murat about some of the progress that they've made there to, of course, we know Turkey is a very big country, and to take screening across that country, how they've been approaching that challenge. So Murat, I hope you're safely online and able to talk us through these developments.
Thank you, Richard. It's now to get time to get motivation. In my country, we don't have any vaccination program. Romania is better than us, but we have a very nice screening program, which means that we can do similar things in my country, in the vaccination area, and in Romania, in the screening area. So everything is actually possible, my dear friends. Just to come together and using the efforts efficiently is the key point. So let me to summarize the summary of this survey in Turkey, the HPV DNA screening. I'm so proud because by 2014, Turkey became the first country in the world who switched to HPV DNA, and we almost finished the 10 years. And I will show you some slides, some figures that what we have achieved up to now without a vaccination program yet. So next slide, please. So we all know very well that HPV DNA screening is better than pap smear alone. Pap smear has been used for more than decades, and it has some scientific, but more than this, it has organizational problems. Pap smear has a very low sensitivity for CIN2 plus lesions, 60%, high false negative rates, low reproducibility between the pathologists or cytotechnician experts, and it's also low efficacy for cervical adenoid cancer. But for countries like Romania and Turkey, it's not only the scientific problems that needs to switch to another screening test, but the main problem is the organizational problems. We don't have a lot of manpower to screen the 70, 80 millions of population. So the manpower disadvantage is great in Romania, in Turkey, in Southeast Europe, but also we have a difficult quality assurance problems with the pap smear. So what about HPV DNA? Next slide, please. Well, it was time to switch to HPV DNA. ECHO, ESGO, ASGO, all scientific societies now recommend for HPV DNA, even in very, very low resource settings. It's really objective, it's automated and can be centralized. It gives you a very great manpower advantage, so you don't need thousands of pathologists. Negative predictivity is very high, sensitivity is very high, 97%. Negative predictivity is 4 times more compared to pap smear, so that you can screen in longer intervals, 5 years, 8 years. We don't have a complex quality criteria. It's also possible to make the HPV DNA in your home with the self-tests. So based on a lot of scientific publications, it's time to really switch to HPV DNA. And we switched in my country by 2014. So next slide, please. As you can see here in the reference and in the YouTube videos, you can watch and read more about Turkey's national screening program. We publish a lot of papers on this HPV DNA, and we are really happy with the initial results. Next slide, please. Until 2014, we had a pap smear program. Every ladies were going every 5 years for pap smear, but the maximum coverage, especially in the primary level, was around 4 to 5%. The manpower, quality control, lack of awareness was the biggest problems. But what we did, next slide, please. After 2014, we switched to HPV DNA with the pap smear. So the GPs were more active in the screening, and the gynecologists became more active in triage of the patients. The national screening program switched for over age 30, every 5 years, HPV DNA on pap smear. But we first look to the HPV. If she's negative, we don't look to the pap smear again. But only we use pap smears for the positive cases. If the patient is HPV 16 or 18 positivity, then we directly refer to colposcopy. But if for the other HPV genotypes, 31, 33, 35, we look then the pap smear, and if the pap smear is ascus or more, we do the colposcopy. Here you see the basic algorithm that we first check HPV positivity. If she is negative, come 5 years later. If she is positive, then we look the genotype, 16 and 18, directly refer to colposcopy. For the others, then we look to pap smear, and the pap smear is abnormal, then we refer to colposcopy. So this is the new screening program after 2014. Next slide, please. And this is what I want to share you. 30 people, my dear friends. For the whole country, I think currently we are 90 million, and we are using a very nice software to follow the patients, and we evaluate 8,000 samples per day. It may be a good example for your countries too. I think the video has stopped now, but does it continue, Richard, now? Can you watch it or not? It stopped, paused in my monitor. Yes. We have a 1 mega laboratory in Ankara, a small one in Istanbul. This is the laboratory in Ankara. It's 4th floor, but only we use actually 1 floor, my dear friends. Really, it's not a WEGA. You don't need such big things. Of course, we have quality criteria, some international experts, and we of course have a call center for the GPs and for the patients. So these are the specimens coming from the GPs, pap smear, and HPV, and all come to this laboratory, HPV laboratory in Ankara. And as I told you, the software is very important. We produce our software RAMLEC, which can track the all specimen from each step of the screening process. You can see different boxes. It's invitation, it's acceptance, it's coming to the GP. Then the specimen is in the cargo, the specimen is in the laboratory. So step by step, we can follow. If there is something red, which means that you have to hurry, because we trust the patients that your result will be available in 10 days. So you see, the boxes are open now. The HPV DNAs and pap smear samples of the patients. So we have a very nice software barcode system. I told you 10,000 per day screening samples to come, and we don't mix one patient sample with another because we use this nice software, and it's impossible to mix one patient sample with another. So once we make the registry in the mega laboratory, as you can see, the HPVs and pap smears coming from the GPs, we will first look if she is HPV positive or negative. So we don't look to pap smears actually, because if she is negative on HPV, we don't need, you know. So let's put the pap smear here. They are waiting the results of HPV first. Now we are starting to look the HPV results of the patients, if she is positive or not. If she is positive, as I told you, we will also check the genotyping. Of course, you can use robotic systems to make more, but the 2 to 3 laboratory staff is sufficient for us. In 8 hours, we can give the results of 3,000 patients, and the laboratory works around 24 hours really. So these are how we prepare the HPV DNAs of these patients. As you know, the denaturation process, the water path. It's the hybrid capture system that we use for 11 years. We have 6 machines of hybrid capture, as you can see here. It's totally automated, and 6 machines means around 12,000 patient results per day. If more patients will come, you see the 6 machines. If more patients will come, it's easy that you can put a more capacity device into the laboratory, but everything goes very smoothly in the last 10 years. Now, we detect the positive cases, as you can see here. The next step was the genotyping of the patients. I think in this plot, the laboratory staff is checking 2 or 3 patients is just positive. HPV positivity is not too much in Turkey, we know it. And now we only get the pap smears of these patients. And as you can see in these pap smears, we use the slides. We have a central pathologies. They only check for HPV positive patients. And the pictures of these patients, the pap smear pictures, are digitally recorded, Now the final laboratory professor agrees on HPV and pap smear result. Once she agrees, the result is on the GP, the result is on the patient. And these are the pap smears, so that we usually collect them for 5 years in our laboratory stores. So this is a mega laboratory. All these HPV negative cases, we wait for 3 months. If there is nothing else, nothing problem, then we of course clean all of them and reuse on the new patients, which is very, very then cost effective. So we don't look to all of these patients. So this is an example of a mega laboratory of HPV that we can really implement in different countries. And today I just give you an example of Turkey. So what happened in Turkey after this mega laboratory in 2014? Next slide, please. This is, you can see the GP level screening rates. It was, remember, 4 to 5%, 200,000 per year, and now it's 1.2 million per year. Except for Corona times in 2021, you see a very high drop in the screening rates. It's really very unbelievable. Just GPs is making more than 1 million screening per year. And if you look to the graphic, you will also see the HPV positivity. In the first round, between 2014 and 2020, we were having around 6% positivity. But in the second round, HPV positivity started to decrease. Now it's around 3%. But it's really nice, around 6 to 7%, 6 to 7 times increase in the screening rates in a large, but a conservative country. Next slide, please. Now we have a very nice online map with this software, street by street, city by city, region by region. You can follow and monitor the positivity of HPV. You can even see how many GPs did match how many screening and what is the best and the most common HPV types in different regions of the country, which is very nice. The cities now really compete with each other for screening after seeing these results per cities. Next slide, please. Again, including the opportunistic screening, we never finished the gynecologist screening, the private hospital screening. So we include the opportunistic plus HPV-based GP screening. And now you can see the screening rate is more than 80%, which is great, except for the COVID area. We are really proud of this. Next slide, please. And of course, for our countries with low income, we need some cheaper HPV DNA tests. These tests are sometimes expensive in different country economies. But as you can see, after having millions of HPV results in my country, now we have the chance to implement our national screening kit, which is CARCI-SCAN. And with ESGO, we make screening with the CARCI-SCAN in some small developing countries like Ghana, some other countries in Africa, and the CARCI-SCAN now in the next few years we will start to use it because it's very, very cheap, and for CIN2 and 3 we have 100% sensitivity. So next slide, please. Yeah, difference, as you can see, for cervical cancer, which is preventable, we have vaccine, we have screening. It is the best to have both vaccine and screening. But in my country, without a vaccination, we achieved very good results. But I know for Turkey and for all Southeast Europe, much can be done, much could be done, but we will do much all together. Thank you so much, my dear Richard. Thank you so much, my dear colleagues.
Thank you so much, Murat, and it definitely can be done, and those figures are really incredible, aren't they? 12,000 patient results, I think I heard, being checked each day, and if we saw in 10 years from 2014, you had, I think, 250,000 tests a year, up now to 1.5 million, so really, really good progress. And I think a message there, we don't need to reinvent things when we want to make policy progress. There are examples and good practices that we can learn from, and I hope, Murat, you won't mind if any of our attendees are in touch with you to learn more from Turkey. So I think we've heard some fantastic tools that can be used to drive better policy implementation. Now, but before we finish this session, I hope we may have some time for questions for those online and in the room as well. But let's remind ourselves why we need those tools so urgently, and we're very, very privileged to have with us today a cervical cancer survivor, Yulia Dimitriou. And if you wouldn't mind sharing some of your experience and what you would most like people to understand from your journey, that would be highly appreciated to frame the context of our discussion. Thank you so much.
Good afternoon, and thank you for giving me the opportunity to be here today. There is a moment when life splits into two parts, before the diagnosis and after the diagnosis. For me, that moment came on the day I heard the words, "You have cancer." I am here today not as a specialist or a doctor, but as a woman who went through cervical cancer. And I choose to speak about my experience because I know how much it would have meant to me to hear a story like this earlier. For a long time, I believed that things like this happen to other people. I think many of us live with this impression that we still have time, that it cannot happen to us, that we are too young or too careful for illness to touch us. I also believed I was an informed person. I went to medical checkups and tried to take care of my health. But the truth is, I did not have the exact information that could have completely changed the course of my life. I did not know enough about HPV. I did not know that HPV vaccination could prevent this type of cancer. I did not know the vaccine is not intended only for children or adolescents. And I did not truly understand how important timely screening could be. The diagnosis came as a shock. Until then, cancer had been something abstract to me. A heavy word, but a distant one. And suddenly, that word became my reality. I remember the fear, the confusion, the questions that appear instantly and for which nobody is ever truly prepared. Will I survive? What will my life look like from now on? What happens next? But one of the hardest moments was not only receiving the diagnosis. It was the moment I had to tell my parents that I had cancer. I believe we speak far too little about the impact such a news has on a family, about what it means for parents to hear their child say those words. At that moment, the illness no longer affects only the patient. It affects an entire family. After the diagnosis, one of the most overwhelming thoughts I had was this. Maybe my story could have been different if I had known that I could get vaccinated against HPV even as an adult. In my case, the disease was detected at an early stage, and that made my treatment and healing process easier than in many other situations. That is exactly why I understand today how important early detection truly is. A screening done in time can make the difference between a manageable treatment and an extremely difficult fight for life. Prevention and screening are not only about better statistics. They mean real chances, lives saved, less suffering for patients and for their families. Cervical cancer does not affect only the body. It affects your femininity, your sense of safety, your relationships, your plans, and your future. As a result of the treatment, I can no longer have children. It is something very difficult to say out loud, because you do not lose only a biological function. You lose a possible future, a part of the life you once imagined in a certain way. This is why we also need to speak more about oncofertility, about the importance of informing patients in time about the options they have to preserve their chance of having children after treatment. For many young women, this conversation can completely change the way they see their future. That is why I strongly believe in the power of information and prevention. Correct information can save lives. Access to prevention can save lives. Vaccination can save lives. Screening can save lives. And I'm saying all of this today not to inspire fear, but to speak about responsibility and hope. Because this is one of the few types of cancer that can actually be prevented. And access to prevention should not depend on luck, on where you were born, or on information you happen to come across by chance. Prevention should not be a luxury, and it should not remain only an objective in a strategy or on an official document. We need clear and accessible medical education. We need real awareness campaigns. We need prevention to reach schools, families, and vulnerable communities. We need HPV vaccination and screening to be explained simply, correctly, and with empathy. Because people cannot make informed decisions if they do not receive the right information. After my treatment, I chose to get vaccinated, because there are other HPV strains I can still protect myself against. I believe prevention also depends on each one of us, on our ability to prioritize our health and not to postpone important things when everything seems fine. To make time for that medical checkup, to talk more openly with our doctors, to inform ourselves from trustworthy sources and seek more than one medical opinion, to go to screening, to consider vaccination because vaccination truly can save lives. These are actions that may seem small or easy to postpone in a busy life, but sometimes these decisions matter far more than we can imagine at the moment we make them. I believe no one should learn about prevention only after going through the disease. And if my story encourages even one woman to go for a checkup, if it encourages even one parent to learn more about vaccination, or if it can contribute even in a small way to decisions that make prevention more accessible for others, then my being here today has meaning. Because today we really have the possibility to change things. And when we have the possibility, I believe we also have the responsibility to act. And I would like to end with one thought. Sometimes we say that prevention is difficult to measure because its results are not immediately visible. But prevention can be seen in the lives that continue normally. In the people who never have to hear the words, "You have cancer." It is within our power to erase cervical cancer from the list. I can no longer change what happened to me. But I hope that from now on, fewer and fewer women like you, your daughter, your mother, your wife, your sister, will have to go through the same experience, Thank you.
Thank you, Julia, for sharing your testimony, and we really appreciate what is a difficult subject and a personal experience to relay, but it was extremely powerful, moving and motivating. The work that we're doing in this collaboration is not optional, it's compulsory. And it is extremely urgent. And you mentioned about trying to influence at least one or more women. We hope to get millions of women and boys vaccinated against HPV from the work we're doing. And we have to turn today's gathering into practical actions, and that will be something we'll be addressing after the next coffee break. And we want to involve you, those online and in the room, with some of those plans. So please do join us after the break for that discussion. And I think you also really touched upon the need that, although we are very focused on vaccination and screening, there's a range of other really critical issues as well, including fertility counselling, which we need to give some attention and thought to. So please take that discussion into the coffee break, refresh yourselves for our final part of the event, and thank you again to all of our speakers.
So we can now continue with the next session. We're going to talk about the future, what is in the plan for the coming year. But first of all, I would like to thank again Juliana for her testimony as a cancer survivor and how brave she is to talk about her battle with the cancer and how important is the prevention. So can we get another applause for her? So regarding our future plans, we are planning to build on the success of the past declaration that we launched in Bulgaria. We are now launching the new. It's basically the same declaration but refreshed with the closing the gaps paper and the eco practice guide for good practice guide for HPV prevention. So now we have the same goals, but also we have integrated the solutions for the countries that still struggle with some of the goals. And you will have there practical things that you can use to maybe help you to implement some of the goals in your country. And the thing is that this time it is more easier to participate in the declaration, to join the declaration, because we had a lot of participants and the signers last year, but this year we made it more easy to support the declaration. So you only need to scan the QR code and you can easily support and sign a declaration in person or as an organization, as an NGO, as a governmental body, and so on. So we hope that we will have now, after this, more people, more organizations, more governmental bodies signing this. So when we have the next Southeast Europe conference, that we will see even more success regarding this. So if you can now take a little bit moment and to scan the QR code and also share it within your networks and within even your colleagues so that we make a huge impact. As I said, the second edition is greater. It has mechanisms that will allow you to make the goals real, to fulfill them. And it's basically in one place everything that we did in the past year. And please, you can see now here how many organizations, clinical centers, medical faculties, NGOs, governmental bodies have signed it. Next year we want to see the number double, triple that is now. So, but you can only help us with that. So please share it and disseminate it within your networks. And now I would like to call Juliana and Richard to tell us a little bit about what's coming and what we are going to expect in the next year.
Thank you very much, Shamil. If we could go to the next slide. And you mentioned, Julian, I feel very passionate that we really need to jump straight out of this meeting and carry on with our work across Southeast Europe with the next round of actions. And that's what we'd like to talk about a bit more. If we go to the next slide, please. Oh, sorry, that's with me. So we have the tools, now let's finish the job. These are the tools that we've been discussing in the last session, the HPV Prevention Policy Atlas, the guide to good practice in vaccination, and the cervical screening recommendations at a European level. But really we have to get these documents, these material, into the hands of the people who can make the decisions, into the hands of the people who've got the fingers on the financial and budget arrangements that can support those recommendations coming into being. So we need a strategy, of course, and for that I'd like to ask my colleague Juliana to talk a little bit about our plans for after the event.
Thank you so much, Richard. And I would like to start highlighting the title of this slide, today is not the finish line, it's the starting point. And why are we saying that? Because we are very happy to announce that after today's event, the European Cancer Organization, together with other stakeholders here today and also additional stakeholders, will develop national expert groups for the 5 countries spotlighted at the beginning of the event: Romania, Bulgaria, Bosnia-Herzegovina, Serbia and Greece. So some of the speakers here today will be leading this work with the European Cancer Organization and others here today. And this group of experts will be working together with us on 4-pagers, focusing on giving every country the tools to do the job, as Richard was mentioning. We'll enter into detail into the different steps afterwards. And after, when we have the expert groups set, we have the 4-pagers translated into the language of each country. We are then doing national advocacy letters to the ministries of health of each country and also to the national committees in the parliament, requesting a hearing to discuss the outcomes and the discussions we had here today, and also the recommendations that experts will develop in the expert group.
And just to go a little further on that, you're here today because you're interested in this topic, because you're willing to give your time and your expertise to driving forward HPV elimination, not only in your country, but across the region and more widely. So we're asking you to please come join us, be part of these expert groups. We've got some fantastic people in Bosnia, in Serbia, Bulgaria, Romania and Greece already committed and helping us make a start on this. But we want to build a team in each of those countries and really be a bit of a pioneer, hopefully to show what can be done in the next 5 countries after that. So we'll be looking at, for example, the index. What does that mean for a particular country? What were the scores that really the health minister and others need to be giving their attention to? Then looking at the HPV vaccination guidance document. What in that guidance could really help that particular country with some of the challenges they've got? It could be in relation to communicating to excluded groups. It could be in relation to the vaccine registry. That will be for the experts to determine what piece of the guidance they want to make a priority. Then when it comes to screening, we have good practices in screening. That was fantastic, the presentation from Turkey. Is that something that the experts in those countries want to flag up as a priority, or are there other topics in relation to data systems supporting screening, for example? So that, we really rely on your guidance from what you're picturing in your country and what you think should be number 1, number 2 and number 3 priorities. And then to get those simple communications onto the desk of the health minister, onto the desk of the parliamentarians. We have a group of national parliamentarians who are committed champions on cancer. They're ready to receive this and they're ready to act on it, to ask questions in Parliament, put up the pressure onto the health ministers. We think this device can be helpful and effective. And as someone was saying to me during the coffee break, whilst there were some great examples presented in the preceding session, maybe a piece that really should be looked at as well is how did you get the minister to accept that policy? So we hope that this can be a kind of battering ram almost to allow initiatives to take place that we all know need to occur.
And because we know, and we already discussed here today, that there's no one-size-fits-all, and although there are common challenges across the countries, there are also specific challenges. These 4-pagers for each of the country will be specific for the challenges and the needs of each country. And so, as Richard was mentioning before, first it will be a focus on where is the country. We already heard a lot about the HPV Prevention Policy Atlas. Of course, in the first page, we just see a color. We'll understand what's behind the color. Why is Romania with a score of 61%? And afterwards, we will develop and explore the recommendations from the ESGO Good Practice Guide on HPV vaccination. We heard from David today, the guide is built in a way that explores 6 different sections. Perhaps for Romania, data systems and monitoring is an important issue to tackle. Perhaps for other countries, it's not the main focus. So we'll adapt the ESGO Good Practice Guide on HPV vaccination for each country, and then we'll focus on the cervical cancer screening recommendations relevant for each of the countries, and then, very important, we'll have local and national commentary from active stakeholders in the ground, policymakers, so we can understand the numbers and set the direction for the future.
Yeah, and I think that fourth piece on the commentary, really important. So we're delighted we've had, for example, here today, the president of the Bulgarian GPs Association, and I'm delighted to see so many young pharmacists with us today, and thank you for being here. And I think when it comes to ministers, politicians, they want to hear from people in their country, and we'd love to have your voice on these documents, your perspectives as to what you see as the future, for example. So it is an open invitation to be involved, and of course documents need to get into people's hands, and the best way we think to do that is if we can get in-person meetings. So we will share those fresh publications in letters to the ministries, letters to the politicians, but then to follow that up with in-person meetings. So this is an open invitation to be involved in this activity.
And as I was mentioning before, we already have great experts on board to what are the next steps of our work, but I'm sure that there are people in the room, people online, and others that can join us in this effort. So you have here my email. Please reach out to me if you'd like to be involved in the next steps, and we'll be glad to work with you on what's the future.
Okay, and we'd like to cover one more point before we open up for any questions or comments that people had, either on what we just presented or in the preceding sections. But we're in a context where HPV cancer elimination is a European goal. It has been since the publication of Europe's Speeding Cancer Plan in 2021. And that goal has really helped to energize countries. Lots of countries that did not have a policy for gender-neutral vaccination have now implemented it. When the plan was published, a minority of countries were going in that direction. Now every single EU country is committed to gender-neutral vaccination, at least in theory and in their policy commitments. But that has also been matched by European funding for projects that bring together agencies across Europe to share good practices, to help develop systems. And some countries as well have been able to make use of regional funding and cohesion funding from the European Union to support the implementation of screening programs, to support the implementation of vaccination programs. So we feel this is really important. Do get your phones out for that QR code, because we'd love you to be part of a response that we're making to the current situation when it comes to the EU budget. So every 7 years there's a big debate between countries as to what EU budget is used for, and right now there is a bit of a threat that health is going to be taken off the agenda, in part response to the European Commission's great desire to place a higher priority on defence and competitiveness. We think that would be an incredible mistake, and would threaten much of the progress that we've made through Europe's Speeding Cancer Plan. So if you share that opinion with us, please do think of adding your name to this joint letter to EU leaders that we'll be publishing at the beginning of June, ahead of an important meeting that they'll be having about the EU budget. So please add your name there, and we'd love to see that in the final publication early June. So with that, Emil, I think maybe just if we wanted to allow any comments or questions.
So if we have no comments or questions, then we can continue with the next session. So the next session will be focused on it will be a political session. It's the name is One Region and One Goal. After we heard the future priorities and plans for the region, we will now engage in discussions and reflections of stakeholders across Southeast Europe based on their experiences and context. So I will give the floor to Richard, who is going to moderate this session. And please, Richard, you can now announce the...
Great, thank you very much, Emil. And now for our final session, I'd invite Selina and George Sorin to join me on the platform if they wouldn't mind, and for some final reflections and thoughts before we close the event. And our first speaker for this panel has been a great friend of not only the HPV coalition in Bulgaria, but of the Southeast Europe collaboration in general. He was a champion for many years in that coalition, and more recently served as a period of time as the health minister in Bulgaria, a job that he recently, after elections, has now gives him an opportunity to perhaps provide us with reflection. So, Professor Oskaliski, drawing on your recent experiences as Minister of Health in Bulgaria and your long-standing commitment to HPV cancer elimination, what do you think are the most important policy commitments that Bulgaria should prioritize following today's discussion and thinking about the advice that we want to give to the Bulgaria government after today?
Good afternoon, dear colleagues. It's a pleasure and honor to be invited to such a important conference and event which brings together practitioners, but also people who are involved in policy development. And I can share, based on my double identity as expert in HPV prevention, but also having been involved in policy making during the last years, that for the successful implementation of a program in HPV, the most important condition is the political will. When I became deputy minister in 2023, the goal of the government was to develop a new program for HPV, both for girls and boys, with a very sensitive approach to fighting disinformation, and with the ambition to have step-by-step higher coverage of vaccination among boys and girls. What I can report to you now is that we are succeeding in this way. The target to have more than 10% vaccination rate for girls is reached. In 2025, we have vaccination coverage among girls with completed vaccination schedule by 19%, which is almost double than in 23-24. So this means that, from my point of view, we are on the right way. What I also can add is the importance of the involvement of the general practitioners. In our case, the deputy coordinator of the Association of the General Practitioners is also my dear colleague, part of the HPV coalition, Dr. Gergana Nikolova, with whom we join forces, and we are increasing the level of acceptance by the general practitioners and of their willingness to actively support the vaccination and to advise parents about vaccination. So from my point of view, these two aspects, the political will and also fighting disinformation, are crucial for the successful implementation of HPV-related policies in Bulgaria in particular and in Eastern Europe in general.
Thank you very much, Professor Okolicki. And I find the emphasis on misinformation, I think, is very important, and political will. You can maybe even put the two things together as we see at EU level a big shift towards EU security discussions and agenda. Certainly at our organisation, we think the battle against misinformation and disinformation should be considered in that context, because actually some of this stuff is coming from outside Europe and from people with bad intent. And so funding to support the fight against misinformation by the EU would clearly be helpful in that regard. Now I'd like to open up to our panelists here in the room with us, and we've heard some very interesting facts and figures about what's been happening in Serbia and the response to that, and of course a very important organisation in all of this has been Progovori. And Selina, I'd like you to maybe tell us a little bit more about the work that's going on to try to improve HPV awareness in particular in that country.
Hello, and thank you for inviting me to be a part of this discussion. My name is Selena Ribic. I'm a cancer survivor, cancer patient advocate, and representative of Udruženje Progovori. It's a Serbian association supporting women affected by gynecologic cancers, and we are working on HPV awareness, prevention, and vaccination advocacy. Today, I'm 30 years old, but when I was only 24 years old, I was diagnosed with ovarian cancer. It changed my life completely. But honestly, I think it was even harder for my mother to look at me sick than it was for me to be sick. After I got sick, all my friends went to their gynecologist appointments. Out of 5 of us, 3 of them were HPV positive, and 2 of them had to undergo medical procedures because of it. And I often think about one thing. If there had been a vaccine that could stop my disease, my cancer, I'm pretty sure my mother would give everything so I could get that vaccine. That is why HPV prevention feels deeply personal to me. For cervical cancer and a few more, we already have prevention. We have vaccination, screening, and possibility to stop cancer before it even starts. After my diagnosis, I joined Udruženje Progovori and turned my personal experience into advocacy work focused on gynecological cancers, HPV awareness, and prevention in Serbia. A few years ago, Serbia made an important first step. Compared to many European countries, we were a bit late, and Serbia introduced HPV vaccination relatively late. But when Serbia introduced HPV vaccination in 2022, it was an important step forward. The vaccine became available free of charge for boys and girls until the age of 9 and 19, funded by the state. Compared to many countries in the region, this was actually a broad and ambitious program. But very quickly we realized that availability isn't the same. It's not enough, actually. It's just not enough. The real issue became trust. This is why Association Progovori, together with our partners, launched the National Alliance Veličanstvene Magnificence, bringing together patient organizations, doctors, institutions, and public figures around one message. HPV prevention must become a normal public health conversation, not a taboo topic. Today, despite the vaccine being available and free, HPV vaccination coverage in Serbia is still around 9%. And honestly, I think that shows that access is no longer the biggest problem. Trust is. It proves trust is. Through conversations with pediatricians and parents, we kept hearing the same thing over and over again. Because the HPV vaccine in Serbia is recommended rather than having the same status as other vaccines, parents have to sign a consent form before the vaccination. And although this sounds like a small inconvenience, a small administrative detail, in reality, it creates fear and confusion. Many parents are still wondering and asking the same question. If I need to sign something, is the vaccine really safe? At the same time, pediatricians often don't have enough time during appointments to explain HPV prevention and long-term cancer risks in detail. And in that space, misinformation spreads very fast. Unfortunately, fear online is often louder than institutions. And this is why we believe vaccination is not only a medical issue, it is also a communication and trust issue. People do not need only access to vaccines. They also need clear information, honest conversations, and reassurance. 2 years ago, our association, Progovori, launched an initiative to equalize the status of the HPV vaccine with all the other vaccines included in Serbia's immunization program. At the moment, HPV vaccination in Serbia is recommended. And through our conversations with parents and pediatricians, we realize that this distinction often creates hesitation and mistrust. This is why our initiative is advocating for HPV vaccination to move from the category of recommended vaccines and become a part of the Serbia's immunization program, with the same institutional status as all the other government-provided vaccines. We decided to launch this initiative because the current situation remains deeply concerning. Nearly 90% of people in Serbia will come into contact with HPV throughout their lives, while 2 women die from cervical cancer every day, every single day in Serbia. 2 women. For us, these numbers clearly show that the current pace of vaccination is not enough if we truly want to reach the World Health Organization's goal for cervical cancer elimination. What gave us hope throughout this process was the strong support we received from our medical community. Our initiative was officially supported by pediatricians, gynecologists, oncologists, medical oncologists, and the National Expert Committee for Immunization. And most recently, the Healthcare Board of Serbian Parliament voted positively on the proposal and officially forwarded to Ministry of Health. At this moment, we are waiting for the next institutional step and hoping to see concrete action in the near future. For us as a patient organization, this was a huge moment because it showed that patient voices and civil society organizations can generally influence public health policy. Several countries in our region are already moving stronger HPV vaccination policies. Croatia and Poland are expected to introduce mandatory HPV vaccination programs starting from 2027, while neighboring North Macedonia has had mandatory HPV vaccination since 2009, and today has vaccination rates around 60 to 65%. For us, this proves that long-term commitment and consistent public health communication really do work. It also shows that meaningful change is possible in our region. For us, for our association, meaningful progress is not only about laws or percentages. It's about creating a society where HPV prevention becomes something normal, where parents are informed instead of being frightened, where awareness campaigns happen constantly, not only once a year, and where patient organizations are included as long-term partners, because patients often communicate with people in a more direct and human way than institutions ever can. And honestly, my biggest hope is very simple. The fewer women in the future will have to say the words, "I have cancer." Because from the perspective of patient organizations, meaningful process is when fewer women need to become patients in the first place. Thank you, and please do not postpone your screening appointment and your vaccination.
Thank you, and congratulations, Selina. I think you made the point so well there. Never underestimate the power of civil society organizations when they get together, work as a team, and then focus their communication towards the people who can make decisions. Exactly, exactly. So I hope we can take some inspiration from that for the work to follow. When we first established the Southeast Europe HPV cancer elimination collaboration. It was a test case last year. We were in Sofia in the National Parliament in Bulgaria. Delighted to have the warm support of the HPV coalition there. And this year, we've been very happy to see that sort of interest for people to be involved grow as new organizations wanted to be a part of the conversation and a part of what we're doing, which we're always happy and welcome to make that happen. And one of those organizations is the European Academy of Dermatology and Venerology. And today has been a great chance to increase our connection with the work that dermatologists are involved in when it comes to this campaign area. So, George, I'd be very happy to hear your remarks.
Thank you very much for the invitation. It's very important for us to be here as organization. And for the sake of time and not to improvise too much, I will also like to read some words that I put together. And first, I have to tell you that from the perspective of a clinician, because I have to make a statement, a conflict of interest, I'm a dermatovenerologist, and therefore you will hear dermatovenerology many times in my talk. So please think that we are together clinicians in this topic. So from the perspective of a clinician, and as task force leader of sexually transmitted infections at the European Academy of Dermatology and Venerology, this is exactly the kind of coalition we need if we are serious about eliminating HPV-related disease in Southeast Europe. Dermatovenerology may not be the first specialty people think of when they hear HPV cancers, but in reality, we are a major entry point into the HPV story. Every day, STI clinics and the dermatology departments across our region see young people with genital warts as a sexually transmitted infections and concern about their sexual health. These are often adolescents and young adults who have never met an oncologist and may never seen a gynecologist or a family doctor who spoke clearly about HPV vaccination. I have to add here that I was happy to listen that colleagues from Bulgaria, patients from Serbia also are willing to involve here general practitioners, and I think that also for Romania this is the case. Without general practitioners, we are losing a lot of interest for those who are dedicated to HPV fight. Let me start from the big picture. Over the years, Southeast Europe has taken important steps together. We now have a joint regional declaration committing countries to eliminate HPV-related cancers, and we have a shared understanding that the tools exist: effective vaccines, screening programs, and evidence-based treatment. It was also shown by our Romanian representative in the European Parliament, Mr. Negrescu, at the beginning. What is often missing is the glue between those tools, the coordination between specialists and sectors that turns tools into impact. So when you ask how we can build stronger cross-specialty collaboration, my answer is very simple. We need to move from isolated efforts to a structured multidisciplinary coalition that operates at three levels: governance, clinical practice, and education. First, at the level of regional and national governance, we should ensure that HPV coalitions are structurally multidisciplinary. At the moment, many HPV working groups are dominated, quite understandably, by oncology and gynecology, sometimes with very strong leadership from public health agencies. That is a good starting point, but it is not sufficient. We need to systematically include STIs and dermatovenerology societies and family medicine. Our clinics reach key population who may never attend organized screening: young men, men who have sex with men, migrants, people and other STIs. If you are not at the same table when national HPV strategies are designed, a large part of the population remain outside of the prevention net. From the EEDV side, the Task Force of STIs and our close collaboration with IUST Europe. IUST Europe is the International Union Against Sexual Transmitted Infection. Provides an existing framework for joint governance and educational activities in sexual health, which are also directly aligned with HPV elimination objectives in this region. The second level is clinical practice, as I said. What happens in the consultation room? Here, cross-specialty collaboration means moving from parallel guidelines to shared messages and shared care pathways. The science is very clear: gender-neutral vaccination before sexual debut, catch-up vaccination for those at higher risk, and strong recommendation from trusted health professionals. The problem is not what we do not know what to do, it's what we do not always say and do in a coherent way. Think of a teenager in our region. They might hear one message from a school campaign, a different one from a pediatrician, and perhaps nothing from a STI clinic. Of course, it's a joke. And sometimes completely contradictory on social media. To change this, each country needs a simple joint HPV prevention statement that is endorsed by all relevant societies: gynecology, oncology, pediatrics, dermatovenerology, family medicine, public health. Shared pathways are equally important. If a young woman comes to a gynecologist for a pap test, a young man comes to a dermatologist for genital warts, or a couple comes to a GP for a discussion of contraceptions, all these encounters should trigger a similar cascade: assessment of HPV vaccination status and offer of vaccination if appropriate, screening and follow-up when indicated, and simple, consistent consulting on HPV and other STIs. That is cross-specialty collaboration in practice. Not a new committee, but patient journey that looks similar regardless of where it starts. This is also where politicians and civil society partners are crucial. We need ministers and parliamentarians to mandate and fund coherent national HPV communication strategies that involve all these clinical voices from the design phase, not an afterthought. We need NGOs and patient groups like the ones represented here today to co-create materials that resonate in Serbia, in Bulgaria, in Greece, in Romania, and in the other countries of the regions. Materials that respond to real fears and misconceptions, not just to express what people think about and what they hear from. The third level is shared monitoring, training, and mutual accountability. When stakeholders from across Southeastern Europe gathered and signed a joint declaration, one of the major commitments was to strengthen data and to share best practices across borders. I would say that cross-specialty collaboration becomes real only when we look at the same data together and allow us to change this. Training is the other side of this coin. EEDV already runs specific HPV courses covering the spectrum from pediatric HPV to HPV in older age, including the role of dermatovenerologists in diagnosis, management, and vaccine implementation. This can easily be adapted into regional multidisciplinary courses with faculty from Southeast Europe offering continuing medical education credits and bringing the dermatologists, venerologists, gynecologists, oncologists, pediatricians, and general practitioners into the same room. When people share these cases, guidelines, and dilemmas face-to-face, trust grows and common language develops. This is a foundation for sustained collaboration. To make this more concrete, I can tell you that we can ensure that upcoming EEDV and IUST Europe meetings will include courses and sessions dedicated to HPV that deliberately mixed faculty from different specialties and countries. Also, our platforms dealing with venerological problems, including HPV, are open for all the persons involved. I mean, not only dermatologists, but specialties, different specialties. They are open, free of charge, so those who are willing to address them are free to do it. Therefore, I think that we have a lot of things to do in common, and to put us together, it's a good thing. Not only gynecologists, oncologists, but also include dermatologists, venerologists, and of course, general practitioners. Thank you.
Thank you so much, George Sorin, and I was really taken by the point you were making there about the messages in clinical interactions with patients. It's not just what we do, it's what we say, and finding means to make sure that people are saying the same things, that there's maybe a bit too much separation of different messages that people are hearing from different people. So when we think about that Romania 4-pager and what we should be advising the health ministry, maybe if you would be welcome to help us frame a recommendation to the ministry on how that might be achieved, that would be a very practical way to pick that up. And congratulations as well to EADV for making that commitment to put HPV onto the agenda of your events, onto the agenda of your conferences. I think every society that's present here has a role to play, and it's by making those firm commitments we can get there. So we've got 3 fantastic experts on our panel, and I'd like to throw open the floor for any questions or comments. And I see one hand up already, and a roving microphone there from...
Thank you, Richard. My first question goes to Selena. First of all, huge respect for everything you do. Getting back after the cancer treatment to regular life is very hard, but getting back to help others not to come in your footsteps, it's really amazing, and I admire the work you do. And my question is, your organization, Progovori, has been doing an important work in Serbia, and what do you think are the next steps that you're going to do in your country to even more increase HPV prevention?
Well, thank you. Thank you for the comment and then for the question. For now, we are waiting for Ministry of Health and their decision. And when they give us the decision, then we'll go along with our campaigns in raising awareness and maybe, not maybe, but surely going to school, pediatricians, and just talking about vaccination, not in a taboo way, but in a normal, healthy, informational way, yeah. So, and we have to put a stop to misinformation on the internet, so that's a big goal for us.
Great, thank you for the question, especially regarding the misinformation. I think this is a huge problem now in the digital era. And my next question goes to George.
May I add something here, because it was shown... okay, now it's okay. No, it's not working.
Do you want
okay, can you hear me? Okay.
Yes.
I just want to add about misinformation. About misinformation, we have a very difficult to share experience here in Romania. It was shown by our colleagues in a previous discussion. 2008, Romania starts the campaign, and it was not very successful, because immediately the campaign started, we had a lot of misinformation in mass media. TV spots, the radio, everything was full with misinformation, misconceptions, and unfortunately, this was driven the campaign out of the rails. And now we had to start again, and for this we need all the people who are in front of the line, who are dealing first with the patients. Now I'm not speaking as EADV, I'm speaking as Romanian. We need GPs, we need dermatologists, and we need gynecologists. Thank you.
And exactly where you stopped, I wanted to make a point and give a question for you. From your perspective, how can we build stronger cross-specialty collaboration across Southeast Europe? You mentioned gynecologists, dermatologists, clinicians, but we need to talk about also head and neck cancers, especially oropharyngeal HPV-positive head and neck cancer that is now in the race. It's the most... now it's #1 head and neck subtype that's the incidence is raising, especially because we didn't vaccinate boys, and it affects women and men. So I'm interested, as you, your opinion as a clinician, how can we address that problem? How can we even more strengthen the collaboration between the clinician to raise the awareness about that, especially when we know that we don't have a screening for oropharyngeal cancers. We have the vaccine, it's great, we are vaccinating people, but the people that didn't get it, they are potentially future patients that will get the cancer associated with HPV, but we have no screening. So should we talk about it more? Should we address that problem? What is your opinion on that? How to solve that?
Never stop talking. Just present it to everybody who is interested and try to convince them, because we are fighting for a good cause. At EADV, we are starting from the beginning. We started with courses that addresses HPV problems. And even if we are dermatovenerologists, we are open to other collaborations. And what can be much clearly stated is that when we had such meetings, we are not staying only with our colleagues, dermatovenerologists, with other members of EADV. We are also able to invite colleagues from other specialties, and we do it. Also, this is happening as a IUST Europe level. When we organize something, we are inviting specialists from different specialties to present their opinion and to share their knowledge, which is always interesting and it's always useful for our colleagues. So this multidisciplinarity that I'm propagating here, to include also dermatology, venerology, general practitioners, it's essential. And I think that only together we can solve the problem. About ENT specialists, I totally agree with you. As a venerologist, I can tell you one thing. For instance, in my hospital, yes, I'm doing tests for STI, sexual transmitted infections. Money are not abundant, so therefore, first of all, you are testing just for patients which are having genital problems. But you are not testing anal, you are not testing pharyngeal. When we started to do this, with some funds that we find out, money can be reached if you want. When we started, we realized that we missed 1/3 of the patient because we didn't test them pharyngeal and anal, mostly pharyngeal. So this is not happening only with gonorrhea, but it's also happening with other diseases. So therefore, it's a clear need to go for tests, and when you find somebody, treat. But of course, don't wait the disease to be discovered by the stages when you have to take difficult decisions, what to cut and where to go. Do it from the beginning, prevention. HPV, it's having a vaccine. Yeah.
Thank you very much.
We've got another question over here, please.
Thank you very much for those very insightful presentations. My question was for you, Selina. I think it was unpicking something that, drawing on Anna's presentation and yourself, and your comment was around it being a recommended vaccine, HPV vaccine being recommended rather than having the same status as some other vaccines. And I just wondered, for those of us perhaps not as familiar with the Serbian situation, could you just tell us a little bit more about that? Is it to do with some vaccines being mandatory and the HPV vaccine not being historically? If you could share any information on that.
Well, if I understand your question well, yeah, there's a list of mandatory vaccines in our immunization program, and now we are waiting for the HPV vaccine Ministry of Health to decide, is it going to be on that list or is it not going to be on that list? And I have to say just that I'm really proud of Serbian media, because media are not spreading misinformation. The real problem are social media. But media, we invested a lot of time and energy in educating journalists like myself and other people to spread really the information. And for now, we're just waiting for the Ministry of Health, and we'll see if it will be on the list.
And just could I follow up? You might not have these figures to hand, but do you have any insights into what vaccination coverage is like for some of these mandatory vaccines? Do you know, is there a significantly higher vaccination rate for these mandatory vaccines compared to?
Yeah, it is. There are long, the list is used for a lot of years, and the results are amazing. That's why we are trying to get HPV there. Yeah.
Thank you.
You're welcome.
One comment to that: I think that the Balkan countries are specific because when we know that we need to do something, we will do it, and when it's an option, then probably we will not do it. So I think this is a good solution to try to make the vaccine mandatory. I don't know if it is going to be feasible, but working towards and implementing it in the Southeast Europe countries would be a good model, because people, when they know that they need to do something, usually they do it. So that was my comment.
I thought you made a very interesting comment as well about the different types of media, and national and sort of traditional media, if you like, tends to be maybe more responsible, and social media, Wild West, isn't it? And that we need some new solutions on that. And so as I was just thinking of Twitter, for example, and you have community notes to try and correct misinformation, but perhaps we need that for YouTube. It's just the sewer of nonsense sometimes. Well, we're moving towards the end, but we still have any last hands going? Otherwise, we will invite Emil to help us close the event, and we'll also hear some words from a very kind supporter today from the Football Federation. And thank you to our panelists and experts online.
Again, an amazing session and great speakers. Also, the discussion was really interesting with good points. And now we are closing our event. It was, for me, a really successful event, and I'm really grateful to the Romanian Football Federation to helping us host this event here and to organize it and facilitate it. I would really like for you all to go home with a common message. So the name of our event is One Goal, One Region, One Goal. So I would like for us all to have this football spirit to act together as a team and to try to be the best at HPV prevention in our countries. We can compete, but let's compete who is going to be better at HPV prevention. So when we come back again next year at the third Southeast European Conference, that we have results that we can share so that the impact of this meeting is going to be visible. Now I would like to introduce Florin Sari, the head of social responsibilities and public policy for the Romanian Football Federation, who helped us a lot to facilitate this event here at the Romanian Football Federation. So please, can we welcome him with a huge applause.
Thank you very much. Ladies and gentlemen, thank you for joining us today. I know that I am preventing you from dinner, so I will try to be as short as possible by mentioning only a few keywords that I took with me after the conference of today. Of course, and I'm opening now a short introduction, football as a sports phenomenon touches millions and reaches millions. It gives us, for many of us, a reason. For many of us, also strong emotions. And not to forget that I think there is nobody in this country, in the region, in Europe, who ignores or lives outside of football. This means that football as a sports phenomenon has a responsibility. It has the responsibility to act in society accordingly to the importance of the phenomenon that I previously described. This responsibility made us, the Romanian Football Federation, join the project, the European funded project that we did together, Prevent Europe. And also it made us stay in a partnership with the European Cancer Organization that exceeds the scope of the initial European funded project. some keywords. Of course, one of them is that if properly identified, HPV-related cancer can be treated. And the other keyword is that vaccination can annihilate this risk. I am looking at the map that has been so kindly presented to us. I'm a journalist and a political scientist, and I cannot ignore maps and geographical realities. And I cannot ignore the fact that behind the Iron Curtain, we are still living in a mentality that is improvable, even when we speak about vaccination, because vaccination is not about the serum. Vaccination is about trust. About trust, you spoke about teamwork. Yeah, we are here in a team. Vaccination is about trust in a society. It's about trust in medicine. And again, I heard a very interesting keyword, general practitioners. As a patient, who luckily for me almost never had the opportunity to visit hospitals. I only went to hospital for 3 times in my life. Once because I ate grass as a child, and 2 times because I had to operate my varicose veins. But as a patient, I cannot stress more the importance of the general practitioners. And I think one of the failures of our societies behind this red line here is also that we as societies do not invest properly in the education and in the well-being of general practitioners. There is a saying here in Romania that disturbs me all the time. The best doctor is the train to Bucharest. Yeah? It's a saying that I hear in many places of the country. Fortunately for us, it worked very well when my father was not diagnosed with cancer in our hometown, but was diagnosed and properly treated, and he leads a very good life, age 86, after being treated of cancer here in Bucharest. So coming back to these keywords, yeah? Prevention, vaccination, early detection, and the role of general practitioners. I think continuing this way, we can be of help here. So please trust us that we will stay involved. Also, please trust us that, and I cannot miss the opportunity to congratulate the incompetence of the auditors of the European Courts of Audits who audited us for being involved in the Prevent Europe project. Yeah? So there was an audit of the European Court of Audits, and they came to us here, and their question was not how was the experience in the project for you. The question is, what's the reason of getting involved? Of course, there is a simple reason why someone gets involved in a project. The reason is because they believe in it. They didn't trust me. Then I gave them another very objective reason. I did the research, and 80% of the children of the employees of the Romanian Football Federation are girls. I have a daughter who has been vaccinated, and again, of course, because this is how life goes, we had to pay for her vaccine. And we didn't do it after being informed by our GP, yeah? We did it after somebody in the family did it and gave us the idea. So the reason why we got involved in the project is here, and it will never change. It is because we feel responsible, we feel that we have the opportunity to share, and also the opportunity to learn. Yeah? Football players, girls and boys, because vaccination, I learned, works better when both girls and boys are vaccinated. Vaccination, I hope, if all goes well, will be also promoted by our football players. it is now, the campaign is still present in the matches of the national female women's teams, yeah. And we hope with your support and in this team that we spoke about, we will make a difference, yeah. I'm really upset about this iron curtain here. I don't like it, yeah. And I think it's also a matter of changing mentalities. I don't want to close before I also express my gratitude to the representatives of the National Public Health Institute. Over the time, we had a very good cooperation in projects of very high sensitivity. And thank you very much again for showing openness, interest, and also, of course, by supporting us with information, not only with decision. Maybe you remember we were involved in Euro 2020 together, which was a success for us also because of the involvement of the National Institute for Health. And I also want to send you the greetings of President Răzvan Burleanu. He couldn't attend the conference today, but he wanted me to send you his greetings. Our president is a very strong supporter of the projects that we do, so trust me, he will become also one of the ambassadors of these initiatives. Okay, again, I don't want you to miss dinner. I've seen it's already set up, so enjoy the rest of your stay in Bucharest. I'm happy that we are here from so many countries in Europe. I'm sure that working together makes us more European, which is the goal that I suppose all of us embraces. Thank you very much.
We would like to express our gratitude to Florian. Can you please stay a little bit more with us? We have prepared something for you, the European Cancer Organization, a small gift for your help and everything for helping us. Please give an applause to Florian again.
I'm not so used to get trophies, you know, and signs of recognition. To be honest, I never got in school, for instance, any trophy. But I also never participated in a contest.
Now we have prepared in the reception, a cocktail reception, so please stay with us. So we will continue our meeting, but outside of this conference room. Thank you once again for everyone being here, and I hope we will see each other again next year. Thank you.